How's everyone? Good evening, Manikam. Good evening. How's everyone doing? Hello, hello. That's great. That's great. So today we are going to discuss history taking only, okay? And I do need 5 to 6 candidates to present history, or I must say to take history, okay? So everyone please gear up, and after the short the presentation of just I will just talk about history taking today, okay? We are not going to discuss the management, we are not going to discuss any other thing apart from that, okay? So I need 5 to 6 volunteers at least. So everybody please gear up. I might take the candidates on my own, or if you guys to volunteer yourself, that's going to be the perfect for me, okay? So please, I need 5 to 6 volunteers. So I will be happy if you guys volunteer yourself. So that's going to be easy for me as well. Okay. So who wants to present? Okay, Fauzia, that's great. So Fauzia is there. Number 1 candidate. 2, please. Okay, okay. Okay, fine, Zumar, no problem. Okay, Manikam, 2nd candidate. And remember, it's only history taking, okay? So I will give you a case and then you will just take history taking, and then we will discuss that what else can be done to improve the history taking only, okay? So we are not going to discuss the management. So that's going to be pretty short for like 5 to 6 minutes or not more than that, okay? And then we will discuss, what can be done and what else can be added, okay, to improve the history taking only. All right. So we have got 2 candidates so far. No one. So trust me, if nobody will present, nobody will ever get to learn. Okay. No problem. Who is asking you to be confident? This is our motive. Okay. This is our motive to just, improve on ourselves. So this is how we will learn. No problem. No problem, Sudeep. Okay. So I'm writing your name as well. So don't worry. We are not testing anyone. We are not testing anyone. Okay. This is just kind of practice. So we can just practice and we can just, improve on if there is any need, or if there is something, you didn't cover. So I can at least, tell you that, I mean, you can add this thing, you can add this thing. This is how you can improve. This is how you can talk. That's it. Okay. Okay. So 2 more candidates, please. No. Okay, fine. No problem. So whoever will come will talk. Okay. No problem. Okay, so today we are just going to talk about the history taking in the MRCOG part 3. I'm sure you all know me, and the one who don't know me, let me just introduce briefly about myself. I'm Dr. Zaib Qureshi. I'm FCPS from Pakistan, MRCOG, and the couple of other things as well. But yes, I'm a very proud MRCOG because after doing MRCOG, I feel myself, bit confident in my communication, in my knowledge, in my, the dealing towards my patient as well, and as well as in my teaching as well. Okay. And because, the MRCOG makes you so confident by the end of your MRCOG that at least, you tend to apply the knowledge, whatever you learn in the MRCOG journey. So obviously, ultimately our goal is to benefit our patients. Okay. So MRCOG gives you opportunity that, I mean, how to communicate effectively with your patients, how to deal with them. And I myself have felt a gross improvement in myself after doing this MRCOG. Practically, I must say the MRCOG part 3, because it really gives us opportunity that how we are going to communicate, how we are going to deal with our patients and all. And obviously, that's what, the purpose of anything, any good, the degree is that, I mean, you tend to improve on your communication skills, your clinical skills, and everything. Okay. Iman, I think you will have to join again, sweetheart. So that's going to be better. Okay, we will start our session, formal session, in just like 1 second. All right. So coming back to our, the session. So history taking is a, the part of our stations, because this is going to be a complete domain in which we are going to be tested on how we are going to communicate with our patients and how we are going to take the history taking. Usually it is, I mean, termed as history taking as well as information gathering too. Okay. So obviously they are both, the synonyms to each other. So what we have to deal today is that we are going to talk about this important domain, because in this the communication will come along as well, and you will be tested on communication with your patients ultimately. And if you are having a the kind of relative, or the any family member as well, so that's going to be communication with the relatives too. So obviously it's not all about that, the history taking is going to be judged only on the history taking, but yes, on the the other things as well. So obviously you have to be very careful about it. Okay. Mm, okay. Okay, all right. So let's talk about this history taking. So how do we say that, history taking, why it is important? Because as a doctor, whenever we treat our patient, the success of treatment depends upon whether you have come up with the right diagnosis, or at least a right set of differential diagnosis. This is very much important, isn't it? So then we have to achieve, after history taking, the above mentioned goal. The key is effective communication. So obviously communication is going to be blended with history taking, and history taking is going to be associated with effective communication as well. So what you have to do is you have to make your conversation effective by knowing the objectives of your conversation. This is very much important. Once your objective is clear, that this is how you are going to start, this is how you are going to convey your message, this is how you are going to take the information you want to take. That is going to be the history taking, and that is going to be the information gathering as well. They say, at various places, that history taking is a one art, and the other is history presentation. For example, sometimes there can be the certain things in which you have to sum up your history, or there can be the history, if it is a station of, like, I mean, kind of structured discussion. So somewhat in that case as well, you have to present history. Sometimes they do ask that summarize the case, and just tell you how you are going to manage this case. Okay, so obviously you will be having complete history, and then you have to summarize. So obviously the way you summarize, that is going to be an art as well. All right, so at all times you have to keep it in your mind, your goal is what in history taking or in any station, to reach a diagnosis, or to reach a probable the diagnosis, or to reach and the exclude all differential diagnosis. Then the other key is to achieve the goal with the help of effective communication. Effective communication. This is not like communication only. This is like effective communication. That how perfectly you are communicating with your the patient, how beautifully you are dealing with her concerns. You are not interrupting her if she is talking. You are not like, I mean, if she's telling you about something and you are bringing some other topic in between. So that should not be the case at all, because they, at every book and in everything, they are telling us that, you have to use the effective communication. Then the third thing is, you should be knowing the objectives of your conversation. You should understand what exactly the station is, what exactly the question is, what are your tasks. So if in the task it is given that you have to do the history taking or the information gathering, then certainly yes, you have to do the history taking, isn't it? Then you have to present the, the history. By the end, once you take complete history, and it is a very good idea that, you have to summarize that history if time allows. But if time doesn't allow, don't talk about it. And we will talk about it in our upcoming slides. Okay, so history is not only like, history taking that we will just talk about few things. Okay, why are you here, what's your problem, and how we are going to deal with it. No, by taking history, you are coming to a probable diagnosis, and you are bringing and excluding differential diagnosis as well. And you have to bring up your effective communication as well. Okay, so yes, I'm going to talk about a bit about ICE. Anybody has any idea about what exactly the ICE is? Anyone? Have you guys heard about it? What is ICE? A wild guess will do so as well. Any idea? Anything that comes up in your mind? No, Iman? Okay. Manikam, Fozia? Any idea?
To break the inhibition between the patient and the doctor, both the communication, there is a inhibition, how to talk like that. So building a rapport, ma'am.
Okay, building a rapport, yeah. Building a rapport, idea, concern, and expectations. Perfect, 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 Mridu. Perfect. Okay, so it is idea, it is to talk about concerns, and it is to talk about expectations as well. Yes, it is to talk about idea, it is to talk about concern, it is to talk about expectations as well. Okay, and what exactly is the idea? What exactly is the idea? How do we say to relieve tension? Yes, you have to break the ice. That's what they say in communication. Okay, because communication itself is a very vast, the topic. Okay, communication is itself is a very vast topic. So they say that you have to break the ice, that you have to talk, that you have to do, you have to get along well in the conversation, because once you will build the rapport with the patient, you will talk about ideas, you will talk about concerns and expectations as well. So then certainly there's going to be a good bonding between you and your patient. Okay, so how do we talk about this ice? Let's see. It's a tool to assess the patient's perspective of the presented problem. This integration of the patient's perspective has some benefits. And what are those benefits? What we are going to achieve? Because it's going to increase the patient satisfaction. Number one, it's going to increase the patient's, the trust on us. It's going to give the patient's idea that, better adherence to the medications is very much important if we are, telling her something. There can be fewer new medications prescribing if we really have to give something. There is going to be lower likelihood of mistakes, because at all times you will be talking that what is your idea, what exactly are your concerns, what are your expectations from today's meeting, okay, or from today's talk or discussion. Then, the fifth component is very much important, that somewhere you have to come to a mutually agreed, safe and acceptable plan. Because this is how the session goes about, isn't it? That you have to talk to the woman, then you have to bring up with your management plan, and then you have to come up at the the perfect plan, what we can the offer to the woman. Sometimes in communication we might as well use ICE, IE, which can be the impact of her problem on herself, on her life, plus dealing with the emotions. And this will going to help us in the breaking bad news stations, because somewhere we have to deal with the emotions as well, because we have to be very empathetic, very sympathetic at that time, because we have to deal with person's emotions too. All right, so this ICE is very much important in any communication there is. So obviously when we are talking about history taking, so yes, communication will be there. So yes, we will be bringing up this ICE and also this IE as well. Okay, then in terms of the ICE again, I would like to talk a bit more about it, because this is very much important in terms of communication, because we have to deal with patients. So ideas can be the every opinion of the patient about the possible diagnosis, treatment, or prognosis. then it can be what they think it might be. So how do we say, tell me about what you think, the cause of it. Okay, can you please tell me what exactly do you think is happening to you? And have you have any idea about it yourself? Can you just sum up with any of the thing that why it is causing you this? Okay, any phrase, any easy phrase you can use to just check the idea. For example, if the woman is coming with pain, so obviously you can just ask about it, that do you have any idea what exactly could be the cause? Do you have any idea that what exactly is causing you this pain? So any phrase, any the easy term you can use, or easy sentence you can use. So concern means the one has to express the fear, worry of the patient about the possible diagnosis or treatment. So you can just ask, are there any specific concerns in today's, the meeting? Or you can just ask that, what are your concerns about it might be?
उसको बोलना कि एक पेन
Is
दिया
there,
था रिफिल लगाने को, ना तो पेन ला के दिया ना.
is there anything particular or specific that you were concerned about? What was the worst thing you were thinking it might be? Okay. So what exactly are your concerns for today's meeting? Is there anything specific you want to talk about? Is there anything, specific you want me to discuss before we discuss, something else? Okay. So this is how you talk about the concerns. Then expectations as well. Expectations mean, their expression or reported expectations about the treatment, diagnosis, or any, the kind of management plan. So it can be what they hope or want next to happen. So the phrases can be, what were you hoping you might be able to do for this? What do you think might be the best plan of action? How might I best help you with this? What were you thinking? What would be the best way of tackling this? So anything, any sentence, you can even bring, whatever you want to bring in. These are some of the examples that how you are going to use this specific I's in your communication. Okay, so clear everyone about this, because at all times you have to be very, the kind of good while you will talk to your patients. Clear everyone? Okay, very good. Great. So the next thing is sources to use for the effective communication, obviously, because we have to use all patient friendly language. We have to deal with the patient up to their level, obviously. So when you are going to deal with the patient, so you have to use the patient friendly language. So we have got a couple of sources. Number one, RCOG patient information leaflet. Okay, and on the RCOG website there is, the patient friendly, you can say the dictionary kind of thing. Okay, so they have beautifully explained all terminologies into layman terminologies, that how you are going to deal with them. Okay, how you are going to explain that, what exactly and what is going to be the easy word to be used for, any kind of medical term. So yes, RCOG number one. Then NHS choices, NHS patient information leaflets, you can use all of them. Then some of the YouTube channels, okay? Because on YouTube channels, you can watch plenty of videos to just improve your communication, to just improve, because, on YouTube, because we are dealing with, the NHS and the UK, and on YouTube, you can see plenty of videos, for the PACES exam, for MRCGP exam, for PLAB 2 exam as well. So all you have to do is that if you are watching, the couple of videos, so by the end, you will be knowing that how you are going to communicate with patients in terms of history taking and all. Okay, so whatever you think you have extracted from anybody, so you can write it down in your own notes or in your notebook if you want to make any. So really it's going to make you, a very good, the person while you will take the history. And yes, never forget RCOG Vimeo channel. That is very much important. Okay, so Vimeo is an app in which there are plenty of videos from Royal College. Okay, so for some of the, the topics, they have made, very beautiful videos. For example, for breaking bad news, I think IUFT, history taking, and consent taking. So please do watch. Okay. So yes, you can utilize any of the source, but obviously, in communication, you can, watch, any of the sources. And yes, from even the USMLE, the some of the USMLE videos as well from the PACES. Okay. So you can, use so many things. so many channels just to learn about effective communication. Your communication should be very flowy, and it should be very smooth, and it should be free of jargons as well. Okay. Vimeo, that is RCOG. Okay. RCOG itself. RCOG. Okay. So do watch. I really, recommend this channel to everybody. Okay, fine. And from YouTube, do watch, the paces, do watch MRCGP channels, do watch Lab2 channels as well. There are plenty of people, working very good on YouTube. So you can always watch if you guys get time. Okay. So yes, a good history taking should be very crisp. Okay. It shouldn't be like, the kind of, the jumping from, the point number 10 to point number 1, then in the middle, then, it should be very crisp. Okay. The person who is judging you, for example, the examiner. So obviously examiner should be knowing that, okay, this candidate knows it's, the task in a very good way. And it should be very structured and focused. It doesn't mean that, the question is all about abdominal pain, and it is, targeting endometriosis, and you are talking about infertility alone. Okay. So if the question is targeting only endometriosis, obviously, yes, we all know that consequences of endometriosis are infertility. But if the question is only about endometriosis and its consequences and blah, blah, blah. So yes, you have to talk more about endometriosis rather than infertility and all. Okay. So it should be very structured. It should be very focused as well. Then use of less jargons. Use of less jargon is very much important, because by this, you have to use at all times patient-friendly language. Patient-friendly language is very much important. Okay. For patient-friendly language, I will advise all of you to please download, the patient information leaflet from Royal College, and then use them. Okay. Use them. The better idea is that you get them printed. Okay. Make your own folders and just try to revise them. So whatever you think is lacking from the guideline, you can just always add. Okay. So that's going to give you, your complete, I can say the set of preparation material by the end of your preparation. Okay. So use less jargons. You should be using patient friendly language. Your history should be structured and focused, and it should be very crisp. Okay. Then the next set is, there should be history taking template, and it should be very clear in everybody's mind. Okay. It doesn't matter what case is coming, doesn't matter what station is coming. So if you know the structure of the history taking, that how you are going to take the history. So yes, it's going to be very easy, even if you don't know a single word about the station which is coming in real exam. Okay. So first of all, when you are entering into the cubicle, when you are approaching the patient, you have to approach in a very calm manner. You have to look very confident. This is very much important. Okay. You shouldn't be like, kind of shaky. You shouldn't be like, there's something, if, at all the previous case was not good and you didn't perform very good. So in that case, what can happen is that obviously it is like, human nature that we will be feeling bad. But, trust me, it shouldn't be on your face, because in next station, you might perform, perfect. So you have to look confident in all cases. Okay. You have to approach, or you have to enter into the cubicle in very calm manner. Okay. Doesn't matter. So these are, the kind of, the simple, the kind of mnemonics, what exactly the history taking, the people take. Approach patient from the right side, but obviously, we are not in physical exam and we don't, do the examination. But this is, the right, the way to approach to a patient. But yes, in the online exam, or even if in because we are dealing with the OSCE, not in the long case. It is for the long case. For example, if somebody is going for MRCPI long cases, so yes, that's going to be, from there. So you have to greet the patient, and this should be very good. At that time, you have to, the very quick and very, the kind of, apart from that, if it is a breaking bad news, or if it is a really, the cancer or IUFT or any kind of other, the station in which, you don't have to look very happy, bubbly jubbly or something, but at all times you have to be composed. You will greet. Okay. And please, do try to, use this thing as well, that, hello, good morning, I'm Dr. So and so, and I'm here to talk to you about this. So you will introduce yourself and you will take consent. Okay, you will take consent. So, I mean, is it okay that if I ask you a couple of questions? Is it okay that if I, just try to note down whatever we are going to talk about today? Okay, because it looks very good that you are using these kind of polite sentences. You are asking the consent to start the meeting. You are asking the consent to note down any the important the thing you want to note it down. So yes, from the 2 minutes time, that your the agenda is that the patient is here because of the vomitings, and then you have to talk about the history of presenting illness. That if there is only vomiting, if there is only pain, so in your mind that what are going to be the differentials for vomiting, what are going to be the differentials for pain only. Okay, so sometimes you have to talk about the history of presenting illness or history of presenting complaint. In many countries, they do use HOPI and HOPC as well. Because we do, I mean, I'm sure we all know that, there are presenting complaints and then history of presenting complaint. Okay, so it should be, in a structured manner again. Okay, so you have to talk about that when exactly this has happened. Okay, then what is the duration of symptoms? What is going to be the progression? Is the symptom progressively worsening or is it static? And is there any aggravating factors? Are there any relieving factors? Is it, I mean, kind of other association as well, to know the other symptoms accompanying the main symptom which help us to rule in or rule out a differential diagnosis? Because at all times you have to be very crisp in your history as well. It doesn't mean that from history of presenting illness you will suddenly jump to the, I mean, do you have any past history of the anything, and how about your periods, and do you have any kind of surgical history? No, history of presenting complaint should be finished first, because this is very much important, because this is the only way you can reach to your the targeted the task. That whether you have to build a diagnosis, then you have to do the management, and then you have to go along with your history, okay, in terms of management or blah blah blah, anything. So history of presenting complaint should be there. Then you will talk about past history. Okay, for example, let me give you an example for this. For example, this is a case of kind of the ovarian cyst. Let's talk about this. Okay, ovarian cyst, and she is postmenopausal, 58-year woman. Ovarian cyst is of more than 5 centimeter, complex, having the RMI of also the kind of 100, let's say. Okay, so yes, this is alarming. So in that case, you will talk about the past history as well, in terms of but you have to be specific. For example, if the task is about the cancer, so obviously you will talk about past history of other the operation, past history of other the medical illness. But don't just talk about, do you have any past history of migraine, because migraine has nothing to do with this such RMI. Okay, so don't unnecessarily drag things into your history. So what happens by the end is that you will lose your time. Okay, because you just are having 10 minutes, and in 10 minutes you have to prove yourself. Okay, so in history taking should be almost from 4 to 5 minutes, but ideally it should be within 5 minutes only. Okay, so within 5 minutes you have to finish. What candidates do is, I mean, do you have any history of the clots in the legs and lungs? Yes, clots are very much important to rule out, but not like, I mean, in kind of particularly in every case. So for example, in real exam, because I have been in examiner, so what happens is that the candidates do ask that from the student as the patient as well, that is there any history of clots, is there any past history? So yes, the role player asks, past history, what past history? So yes, specifically ask past history of what, specifically ask surgical history of what, particularly this case. In terms of this ovarian cyst, then yes, you will talk about the family history of cancers as well. Okay, because you have to exclude the any, although the ovarian history, ovarian cancer, endometrial cancer, breast history, any colon or anything, you will talk about family history as well. In terms of gynecological history, you will talk about the cycle. You will talk about the are your cycle the regular? Is there any history of do you ever bleed between 2 cycles? Because you have to rule the INB, you have to rule PCB. If it is a the case of any HMB, if it is a case of the cervical problem, if it is a case of any endometrial problem or something. All right. So in terms of obstetrical history, yes, you have to talk about obstetrical history. For example, this is a case of, the woman who is laboring and now she has ended up into the cesarean section. So obviously you have to talk about much bit more in detail, but at that time you're not going to emphasize on the gynecological history. You're not going to spend a lot of time on smear. You're not, even in obstetrical case, even if you forget, if that is not a relevant thing for the smear, even if you forget smear, that I didn't ask about smear. So it doesn't make any difference. Okay, it's not going to put a lot of difference in your collective marks. But yes, if you forget to talk about the obstetrical history in terms of that she is going to be in the the cesarean section. So what if in the previous the obstetrical history she has had some kind of the problem, what you needed, what you should know. Okay, so please don't try to be like, fix in your thoughts when you are taking histories. Okay, you have to be very the kind of I must say a kind of the tricky in taking history as well. So in obstetrical case, don't just waste a lot of time on gynecological history only. Okay, intermenstrual bleeding, postcoital bleeding, and heavy bleeding, cycle bleeding, when was your last period? So it's not going to the matter in that case. Drug history is important. Okay, that are you on any the medications at the moment? Okay, so if she is on, then you can just ask that, for example, if you missed something from medical the history. For example, if she's a case of any prolonged illness, if she is on prolonged medications, obviously yes, she's going to tell you. So this is how you are going to fit your medical history, even if you forgot to ask. Okay, so history of allergy is very much important in terms of this allergy is going to be very important in many cases. For example, you have to prescribe any medication. For example, you have to go for any the kind of examination. For example, she is allergic to anything, the latex. She is allergic to the vitamin A containing the fish or something, or fish oil or something. Okay, she is allergic to iodine. She is allergic to copper. She is allergic to nickel. She is allergic to blah blah blah, anything. So that is very much important. And whenever you come across with allergy, at the same time, you will kill this concern as well. You will say, okay, I will write down in your, the notes as well, that you are allergic to benzalpenicillin, you are allergic to metronidazole, you are allergic to the cephalosporin group or something. Okay, or even the sulfur containing drugs as well, because we know as a doctor that these drugs, they do have allergic the history as well. Because even I had the one patient in last month, and she was allergic to simple paracetamol, and I was quite shocked to know that how one can be allergic to paracetamol, but she was allergic to paracetamol. Okay, so this is very much important to just note down that personal history. Personal history is also very important. Like, in terms of, do you smoke, do you drink, or do you take any recreational drugs? All right. So here I want to emphasize on one thing. If somebody is smoking 1 cigarette, or somebody is smoking 11 cigarettes, which one is bad? 1, 2, 3, or 11? Anyone? Obviously 11, isn't it? Makes sense that 11 is bad. What candidate do is that if somebody, they come to know from the history that, okay, I do smoke 1 cigarette, 2 cigarette, 3 cigarette. Okay, then they will say at the same time, okay, we have got very good service in which we provide help to stop or reduce the smoking, and I would like to put you in touch with that and just stop smoking cessation services program. Okay, makes sense. And this is very good that if somebody is giving anyone idea about, then it is stop smoking cessation service. Okay, but ideally, 1, 2 cigarettes are like, okay. Or if somebody is saying that, yes, as a whole, we shouldn't be encouraging cigarette smoking to, the pregnant ladies or to the ladies who are, about to become pregnant in preconception care. Okay. So, but idea of the NHS stop smoking cessation services, if somebody is smoking only 1 cigarette, and you are putting in touch with NHS stop smoking cessation service, okay, and she is telling you that I'm an occasional smoker, or I'm an occasional the kind of I just smoke on the parties or something. So I don't think in that case you have to put her in touch. You are putting an unnecessary burden to an organization. in which, you have to put in touch with, the NHS Stop Smoking Cessation services to the women who are hardly, who are badly in need of, any kind of services. So please, all of you who are going for MRCOG Part 3, be extremely careful, because this really takes a lot of time. It is going to take your, the precious 1 minute when you are going to say this long phrase. Okay, that we have a very beautiful service, because I do see, because I do coach many candidates. So what they do is that this is how they lose the time. Okay, so please be extremely careful, but don't forget to put her in touch with the NHS Stop Smoking Cessation services if she is on 7, 8, 9, 10, 11, because we know that, if she is a pregnant lady and she is smoking and she is on, up to 5 cigarettes, okay, so that's going to be the minor, and more than 11 is going to be the major risk factors for IUDR. Okay, so yes, in that case, we need to be very, the cautious. Then in terms of alcohol as well, so yes, if she's a party drinker, so that's okay. But if she's a, the alcoholic, and she is taking, many, the kind of glasses or of, whatever you can say, she is on regular drinker on daily basis. So yes, you have to advise her to stop or to reduce it. And then yes, you need to, take help from, the other services as well. In terms of drugs, recreational drugs, yes, you will just touch and you will just leave if you think that this is not the agenda of the case. Okay, don't put a lot of time on this thing, that, do you smoke, how many cigarettes, do you drink alcohol, that how many, I mean, do you do any kind of recreational drugs? So what I do and I suggest to all my candidates is that it's better to take, this thing in one phrase. Do you smoke, drink, or do any recreational drugs? That's it. If she is smoking, she will tell you, then yes, doctor, I do. Then you can ask next question. Can I ask that how many cigarettes? So if she is telling you that I am taking, a pack a day, a pack contains 20 cigarettes, then obviously that's going to be alarming. But don't, bring this thing on your face that you are astonished or that you are very much surprised to know that somebody is having a pack a day. All right. So because at that time, the examiner is going to judge on your face that whether you are going to be judgmental or what, whether you are going to feel bad about this. No, as a doctor, as a practitioner, we don't have to bring any kind of, the judgmental thing on our face as well. Because the examiners, for example, in some cases, if the lay examiners are there, they are going to judge, from your all expressions. All right, so don't put a lot of time on, the history taking. So just leave and judge. In terms of socio-economic, this is also very important, because you will be asking about whom do you live with, what do you do for living, okay, or I mean, whom do you live with, because at that time you have to exclude domestic abuse as well. Okay, you have to yes, this is a very the common kind of mistake. Okay, what sometimes, because this is very natural, that if we come across with something, that if somebody is smoking a packet, it's obviously sometimes we do feel that, really, are you taking 20 cigarettes a day? Okay, but that's judgmental. That's pretty judgmental, in fact. Okay, because they really note, because in some cases, the role players, they do give us, the marks as well, that whether they are happy with our consultation, whether they want to see us in future, or whether they will think about that, yes, they want to see us or not. Okay, so that's very important. So you don't have to bring that look on your face that at all times you are, you should be non-judgmental at all times, I must say. Okay. All right. In terms of, the socio-economic, I said that whom do you live with is very much important. But and don't be so surprised if she is living with partner, because we are dealing with the system in which these things are very common. Okay, partner and, or anything. So don't look here like a kind of, the surprise that if somebody is telling you this. Okay. And then you can say that how are things around, do you think do you think you are a happy couple? Do you feel yourself safe with them? Okay, so this is how you are going to exclude the domestic abuse or domestic violence or anything. This mental health questionnaire is very much important these days, because yes, mental health is at the kind of problem, I mean, all around the globe. And in the last 2 years, then yes, it has I mean, risen up to the extent there, yes, it is affecting the quality of life. Okay, so you have to exclude mental health questions. Can anybody tell me that what exactly are mental health questions? What do we ask to our patients in our history? Anyone?
Yes, we can ask it. How do you feel in the past few months
Few months?
or weeks?
How many weeks, sweetheart?
How do you feel in the last few weeks?
Last 2 months. And during the last 2 months, have you ever bothering feeling of low interest or pleasure to do things? And any have you ever been bothering about depressed or anxious or any problems?
Any problems is okay, but I think it is very, we have to be very specific. Any problem, I have my problem, I don't have any job. So is it your problem? We are dealing with mental health, okay? So we have to be very specific. So we can say that, have you often been bothered by feeling down, depressed or hopeless in the last month, okay? In the last 4 weeks, okay? That is very much important because we are dealing with the, the recent thing. Yes, depressed you can ask, okay? Or because we are talking about, the simple terminology. So I will advise that everybody using, the very easy jargons, all right? So it's very beautiful to talk about. Do you ever feel, or have you ever often been bothered by feeling down, depressed or hopeless in the last 4 weeks? Okay, in the last 4 months. Or you can say that, have you been bothered by having, the little interest or lack of interest or pleasure in doing things? Because this is you are just going to exclude that, whether this woman is suffering from any, the mental health or not. Because these are Wooley's questions, screening questions. Because after having two, questions, if she's saying yes to any of the questions, so what you will do in that case, you will go and you will ask about the full questionnaire of Wooley, or you can say the, the GAD-7 score, GAD-10 score, okay? Or then obviously you will refer her to the mental health specialist as well. There is a message. Okay, fine. We can help you with this. I think Miss Paris. So we can help you with this, and you can, get in touch with me, and you can get in touch with our team as well. Okay. And yes, we are running a course, and I think on 29th we have clinical governance class. So if you are interested, I can put you in touch with our, the team members as well. All right. Or you can just reach out to me on Telegram or on Facebook as well. Med exam expert. Okay. So you can talk to Mafia, you can talk to Anam, Asma, okay, Mughira, anyone. So you can talk. All right. All right. Yes, these are the links, sweetheart. If you can just go through the chat, so you can just, the contact. Can get the contact. Okay, okay, fine. Thank you. Okay, all right. So this is how you will just, talk about the history, that you will go in a systematic way. You will go in a systematic way. All right. Presenting complaint, history of presenting complaint, past history, past medical, past surgical. Then you will talk about, the family history, then gynecological history, obstetrical history, drug history, history of allergy, then person history, or you can say the personal habits, socioeconomic history, mental health questions. So this is going to be a simple template that how you will take the history. And yes, for every module, for every case, your history should be according to that module only. Okay, you shouldn't be, dwelling in the question. You shouldn't be, the dwelling with your Iman. Okay, Iman, thank you so much. Thank you so much. Take good care of you. Okay, all right. So I think now you should be very clear in this thing, that how you will approach and how you will talk and how you will behave. Okay, because this is very much important. So ending the consultation is also a very good idea, that how you are going to end your consultation. Because end of the consultation is very much important for two reasons. Number one, you need to check that the information you have is complete and accurate. Number two, the patient needs to know what will happen next. All consultations should have a definite conclusion, because this is very much important. And that's why when we make our agenda, so then we say that, okay, after this, I will try to give you a very much safe, agreeable, acceptable, and a good plan. Okay, a comprehensive plan, that how we are going to deal with your, the pain, or how we are going to deal with your, the vomiting or anything whatsoever. So yes, it is very much important that your consultation should have a good end. And in MRCOG, we do say that you have to close the loop. From the hello till bye, you have to close the loop. Okay, because in the end, if you're not asking that, no, am I clear so far? Do you have any other question? Is there anything you want me to clear? Is there anything you want me to repeat? So yes, that's going to give a very beautiful, the picture to your consultation. And it also gives an idea to the examiner as well that yes, you are a good, competent, and the safe doctor as well, who is very much concerned with patient's health, who is very much concerned with patient's time and all. Okay, so you have to deal, this is what I have concluded, and this is what I thought of, that we have to follow 5-point plan. That when you are satisfied that you have completed the history taking, tell the patient that you have covered everything that you need to. Okay, so at that time you will thank the patient. Okay, then you will say, okay, thank you so much for giving me this information. Is there something I should know more about? Is there anything I was missing? Is there anything you want to add? Sorry. So this is going to be the second point. Check that the patient has nothing more to add. Okay, so in that case you can ask, is it, is that it, or is there anything you want to add, or is there anything particular which you are missing or which I am missing? Is there anything which should be added more? Okay, then you will summarize. You will summarize the information and check that it is complete and accurate. You will summarize that, okay, look, Jenny, I understand from your history and after talking to you that you are 23 years, you are currently 12 weeks in your pregnancy, and at the moment you are having abdominal lower tummy pain, and it is not associated with any kind of bleeding or anything, and sometimes you do have vomitings, and you don't have any specific past history of any illness or something, and not even the surgery as well. And in terms of and today you want to just talk about this pain. Is it okay, or is there anything I was missing? Because you have to summarize if the time allows, and always remember, in summary, you have to take only positive points from your HOPC. Okay, you don't have to bring complete history again. You will just take positive points. Okay, positive points mean the positive points in terms of your history, in terms of your case. Then you will explain what will happen next. Okay, then you will pass the information on to the doctor, whether they are going to be seen soon by the doctor or not, for example. Okay, your consultant, I must say. Okay, so in that case you can say that, okay, for example, she is having more than one problem. For example, she is having more than the 2, 3, 4, 5 complaints. So first of all, you will give her time. You will just listen to her 1, 2, 3, 4. But again, you will interrupt, because you are the losing your time, because you don't have only 10 minutes. If she is the talking and keep on talking, then what will happen? You will not come to a conclusion what exactly is bothering her, what exactly is her main complaint. Then you will ask that, okay, I understand that you are having all these problems, but can I ask that at the moment what is bothering you the most? So this is how you will cut short these complaints. Okay, you will just ask that at that time, that what exactly is bothering you the most. Okay, out of these, is there anything which is bothering you the most? Okay, any sentence, anything which you think you can bring. So this is how you are going to cut, and this is how you are going to save your precious time. Then in the end, after taking history, you will thank the patient. Okay, or if you have to leave, you will leave immediately after concluding the interview. But yes, thanking the patient is a very good idea, because then you will say, okay, thank you so much for giving me this information. So then if you have summarized, then you can say that, thank you so much for giving me this information. Now I will try to take help from my other colleagues as well. Then I would like to run some investigations on you, and if the needed, then I might do some kind of examination on you as well, if if at all it is needed. But don't offer examination with chaperone to all the woman who is coming for anything whatsoever. Okay, but you won't believe that it really looks so weird that even in simple case everybody is offering the examination in the presence of chaperone. Why? If that is not the necessity of the case, that why are you offering? You can say that I might need to examine you. Okay, you say always, I will check your blood pressure, I will check your pulse, I will check your height and weight ratio. I will do this, I will do this, I will do this. By doing all this, you are losing your 2 minutes. So you have taken 6 minutes for history, 2 minutes for this examination, and then you are left with only 2 minutes. So do you think that you can, finish your station on time? I'm afraid no, because then you have to manage the case, then you have to ask, then you have to, explain each and everything. Then you have to come to a conclusion. Then you have to ask her, okay, what she thinks of, her diagnosis or her treatment or management plan as well, because that is our agenda. Okay, so in short, your history should be very crisp. Okay, your history should be very, the kind of, the beautiful, and it shouldn't be like, you shouldn't be jumping in the history from, top to the bottom and then bottom to the top again. Anything, this is a question somebody was asking me other day, that what if we miss something? Doesn't matter. If you are missing something at any point in consultation, for example, many candidates miss the history of allergy. Doesn't matter. It doesn't matter. This is your station. Okay, you can bring this allergy while you are talking about the prescribing the medications. For example, this is a case of PID. Okay, pelvic inflammatory disease. Or for example, accurately, there is a recall question in which is a case of, the bacterial vaginosis or candidiasis, and she is allergic to metronidazole. So we know that in bacterial vaginosis we have to give metronidazole. Yeah. So, and you forgot to ask this history of allergy initially in the history. So what you will do in that case? Okay. So because you know that bacterial vaginosis treatment options are very limited, we do give metronidazole, we do give clindamycin as well. Okay. So once you will come to the management plan, then you can say, oh, before I, start giving you this medication, can I ask, are you allergic to any medication? Okay, so you will fit that, in here, rather than fitting this history of allergy while you are, in the middle or in the end of your history, or, after thanking and summarizing, then you will, oh, I forgot to ask that, are you allergic to anything? Okay, it doesn't make, it doesn't look good, nice, I must say, although you might, fill your history template, but sometimes you can cover. Okay, for example, if you are talking about consequences later on, in any case, for example, for the cancers, and you are talking about the past history and you missed to take the past history. Okay, so in that case, you can just fit, okay, in here as well. She has had history of breast cancer, and she was a case of tamoxifen, and she stopped using tamoxifen 2 years ago because that was completed, for the 5 years. But yes, you forgot. And then in the end, in the management of this case, for example, if you have to bring, then you can just ask, okay, I forgot to ask that, do you have any past history of any cancer or something? So she might give you a hint again. Or probably if you are swaying here and there, trust me, role players guide you. Okay, role players give you cues and ideas that where are you going wrong, and they will push you to the case again. Okay, so don't forget to take the cues, and don't just be in your own thoughts that, okay, I have to, finish the template. Okay, I have practiced this case with, so and so and someone. So, I have to, finish this case. No, it shouldn't be, the kind of a very firm thing that you have to finish a case according to your own process, okay, according to your own thoughts. It should be according to the case, how role player is presenting to you and how you have to, behave. Okay, clear everyone? So this was a general talk about history taking. Is there any question? Is there anything you want to add? Please do. Is there anything? No? Why everyone is silent today? Okay, no problem. So I need volunteers. Okay, so I already have 3 volunteers. I need 2 more volunteers. Okay, so I do have Miss Fozia, Miss Manikam, and Sudip. So I need 2 more volunteers because we are going to talk about histories now only. Okay, so because we have to practice almost 5 to 6 stations in terms of history. Okay,
can I, ma'am?
can I know your name, sweetheart? Yes, you can.
My name is Intisar Abdul Qadir.
Okay, Intasar Abdul Qadir. Yes, very good. One more candidate. One more candidate, please. Thank you so
Can
much.
I please?
Yes, sure. Can I ask your name, please?
I'm Aina.
Aina. Okay, beautiful name. Good.
Thank you.
Good.
Thank you.
Okay, nice. Okay, great. So who wants to come first?
Okay, doctor, I will.
Okay, fine, sweetheart, come forward. And remember, we are just taking history taking, okay?
Okay, okay.
Don't waste time in management, don't do anything. We are just history taking, and I will set your time for 5 minutes, okay? You have to finish the history taking in just 5 minutes, all right?
Okay,
Roughly,
okay.
roughly it is 5 minutes, but ideally it should be within 5 minutes. Hardly in between 4 to 5 minutes, not more than that, okay?
Okay, doctor, okay.
Okay, fine. Come, sweetheart. So let me start the time. Okay, fine. So let me show you the case first, and then we will start. You can take your 2 minutes, okay?
Okay, doctor, thank you.
Okay, take your 2 minutes. Start now. Okay, ready?
Yes, ready. Okay.
Okay, fine. Yes, start.
I am Dr. Fozia, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yes, I'm Mrs. Ruth Parker, and I'm 28 years.
What would you like me to call you?
Ruth is fine, doctor.
Okay, Ruth, we are here to discuss your scan and blood report. Is that right?
Yes, doctor.
Okay. Before discussing the reports and your scan, I want to ask you a couple of questions to know more about you. Is that okay for you?
Yes, doctor, that is okay. But I'm kind of upset, why the sonographer was very much, apprehensive while she was doing my scan, and she just asked, me to meet you right away. Is there anything, concerning in this scan? Is there anything, I must be, like kind of, bothered?
Yes, Ruth, in a few minutes, we are going to discuss this. But to know more about you, I want to ask you a couple of questions because we are meeting for the first time. Is that okay for you?
Okay, fine, doctor. Yes.
Okay, Ruth, can you tell me more about this pregnancy?
Yes, doctor. I am 13 weeks pregnant, and it was like, I mean, kind of okay. Everything was going fine. I didn't had any kind of problem. And today, I came here for this scan and I had, all my blood checks. So yes, that's why I'm here.
Okay. And Ruth, are you taking folic acid?
Yes, doctor. I was taking folic acid. Midwife gave me.
Okay. And you have done your first scan with her for heartbeat.
Yes.
Do you have any other problem in this pregnancy?
No, everything was quite fine.
Okay. Now, can you tell me that have you ever been pregnant before?
Yes, I have, the two babies before as well.
And how they deliver and how they are going?
Yeah, they are fine. And my one boy is like, I mean, 7 years, and the girl is 5 years, and both are pretty fine.
Okay, that's good. And any problem in their deliveries? They deliver
No,
normally
no,
or
no. They both were born vaginally. I didn't had any kind of problem, any complication, anything, nothing. It was quite okay.
any miscarriages before?
No, doctor, not at all.
Okay, and you are telling that your little one is 4 years. Are you using any kind of contraception?
No, we were just having, the condoms off and on, and apart from that, nothing.
Is this a planned pregnancy?
Yes, doctor, it's a plan.
Okay, and what about your periods? Your periods are regular?
Yes, they were quite regular, and we were just planning because the kids, they really wanted to have the new the small kid in our house. So obviously we were planning, so that's why.
Okay, can you tell me, do you have any medical problem for which you are going to your GP?
Problem like?
Any medical problem? Any
No,
medical
doctor.
condition?
No,
Okay.
nothing. I'm generally fit and well.
Any surgery on the tummy or down below?
No, doctor.
Any family history of concerns?
No concerns been.
Any family history of any history of congenital abnormalities, like abnormalities in the babies, in your sisters or in mother?
No, doctor, but I can recall that one of my, the far cousin, that he had one baby and he had Down syndrome, I think. Yeah.
Okay, I understand. And what about you have any allergies?
No, doctor.
Any allergies with any drug or any food? Any kind
No,
of
doctor.
allergies?
No, doctor. No.
Okay. Do you smoke, take alcohol, or any recreational drugs?
No, not at all.
I really appreciate this. And what about things at home? Do you feel that you are a happy couple?
Yes, doctor. We are like, I mean, we do have two kids, and my husband is quite supportive, and everything is like, I mean, almost good. Yeah.
What do you do for your living?
I work as a secretary in an office.
Okay. And how do you feel in the past few months? Do you feel down or depressed like this?
Not exactly. I'm just worried, that, but now I'm worried that, why this doctor was very much concerned about the scan, why she was like, I mean, very much bothered about this.
Okay, I understand your concern. I'm seeing that you are. Do you want to add anything in this conversation? Do you want me to
Uh,
know anything more?
no, doctor, no.
Okay. Now, before discussing your reports, I'm seeing that you are alone here. Do you want to accompany anybody? So you can call. I can wait, or I can arrange another appointment for you as you like.
Okay, doctor, I would like to call my husband.
Okay, that's good. You can call. Then we will continue the conversation regarding your report.
Okay, fine, doctor. Thank you. I appreciate. Thank you so much.
Thank you very much.
Okay. So, Fauziya, how was it?
I don't know, maybe I missed points because I rather folic acid and previous history I didn't understand what to ask more, because she's telling she's already following with the midwife and taking folic acid also. So
Okay. I think you were okay, but let's come to the the problem. Now we do have an encephaly. So what are the
yes,
causes?
yes.
What are the causes of an encephaly? So we have to exclude from history. Yes.
Yes, first the folic acid, and because it came in entities and also some kind of infections. So I have to ask the infections also and history of.
Infection, I think infection, no. Right? Is there any infection which causes anencephaly? I don't think so. Because the
No,
infection causes microcephaly or
no,
hydrocephalus.
yes, microcephaly. Yes, yes,
Yes,
yes.
microcephaly or hydrocephalus. So yes, you have to talk about folic acid. If you are talking about folic acid, then at the same time you have to ask about what? I mean, can you tell me the dose?
Okay.
Antibiotic drugs.
Okay. At the same time, you will talk about that. I mean, can you tell me the dose of the folic acid? Okay. Then you can ask about the family history of neural tube defect. Yes, that is very much
Okay.
important. And just ask about
Okay.
it. And sweetheart, when we know that in an anencephaly, it is very much important to know about the family history. So yes, you are not going to just ask about is there family history of concern? So which concern? Okay. So
Okay. Okay.
in this case, our concern is not clot, our concern is not heart disease, our concern is not, the asthma or something. Our concern is family history of neural tube defect. Okay, so at
Okay.
that
Okay.
time you can just ask about that. I mean, is there family history of any kind of genetic problem or any, the problem with the babies when they were born? Like, I mean, is there any kind of problem? I mean, genetic problem you can just ask in another words. Okay, is there any family
Okay.
history of genetic problems in the babies or something? Okay, or is there any family history of any Down syndrome or any other problem in the babies? Okay, now she's telling you that in far, far cousin, I had Down syndrome. So you will just acknowledge, okay, and you did acknowledge, that was good. And then you asked about when she's telling you that I didn't had any kind of problem in the pregnancy, okay, so don't just repeat the information again, that do you have any problem in the pregnancy, okay. So
Okay. Okay. Okay.
this is how you can cut your history, okay. So this is what I have noticed. In terms of if she's telling you that I had the two babies and both were born vaginally, and at the same time she can tell you that I had the one miscarriage as well, but you asked about miscarriage, it was okay. Okay, now I will come to you and ask you, the rest of the history was okay, rest of the history was good, okay. Now I want to put more emphasis on the anencephaly. Folic acid, you will ask about those, family history of neural tube defects, and what are the other causes of the anencephaly as well. BMI, high BMI, isn't it? High BMI sometimes we
Yes, I
do
didn't
have,
ask from.
yes, we do have reason of high BMI in the setting of anencephaly as well. We do have diabetes mellitus as well. If she is having, because when you are asking about that, I mean, do you see your GP for any other thing? So if she is asking you that which concern, what type of problem, so at that time you can say that, I mean, do you have any history of diabetes in your family or in your past as well? Or I mean, especially diabetes, because this is how you will emphasize on diabetes, because you know that diabetes is associated with anencephaly, okay, neural tube defect,
Yes.
if
Yes.
it is type 1 more, okay. So you can talk about this. Rest, I think history was okay. Moreover, if this question comes, so this is going to be somewhat, the Breaking Bad cues. This is going to be somewhat, the kind of communication skills. But today we are
Yes.
just talking about history taking. So I think only these points were lacking. So altogether, very good. Okay. Very good.
Thank you very much. Thank you very much, Doctor.
Okay. Okay, sweetheart. Very good. So, what are your thoughts, everyone? So, is there any, the kind of anything which can be added or which can be done more? Anyone?
Yes,
Antiepileptic
Dr.
drugs,
Ji,
madam.
I want to add something.
Mm-hmm.
Yeah,
can
I think that this for recreational drugs, we cannot ask the question directly. I think we need to ask the patient that this is part of my job, that I need to ask you this question regarding some alcohol and these things. Alcohol we can ask, but recreational drugs is a sensitive point.
You can ask. You can ask if you think. Okay. So it doesn't
Okay, thank
matter
you.
as long as you are happy, you are okay. You look confident. You feel that you are okay to continue the consultation. That is pretty okay. Okay. It doesn't
Okay,
matter.
thank you.
we
Okay.
can ask
Okay.
we can ask
Yes.
also about consanguinity.
Consanguinity. Anencephaly. Is there any, I mean, relation with this?
I don't know, maybe genetic problem or anything.
Rather, I would say that this anencephaly per se is the very a condition in which, we can diagnose very early in pregnancy. And sometimes, it is not like, kind of this. Sometimes there is going to be folic acid deficiency, past obstetrical history, past history of neural tube defects, basically high BMI, diabetes, some kind of, literature says that some kind of environmental factors as well. Consanguinity, probably you can just ask, okay? But I think I'm little skeptical about it, that whether it is a direct cause of NNF3 or not, okay? But yes,
Okay.
as long as you think, because I always say that in terms of history or any case, you have to be confident as well, okay? And you have to be like kind of smooth as well. And it shouldn't be like that you are missing something, okay? Just go, it should be in a flow, it should be in a row. So you shouldn't be like shaky in your history taking. All right, very good. Does the report need to be discussed first, or do we wait until history is over? Okay, there are two schools of thought in the Breaking Bad News, and I think we do have, the one session by Dr. Pooja on Breaking Bad News. So if you guys just take the, the few minutes to just watch that video on YouTube channel of MedExam Expert, I think it's going to give you an idea. And apart from this, I will just say that, there are two schools of thoughts for Breaking Bad News as well. Sometimes they say that if the woman is telling you again and again that no, I want to know about the report first, I want to know, I'm very much apprehensive, I just want to know about the report, doctor, what exactly is in the report. At that time, you're not just going to be, strict to your template that, oh, no, I will be telling you after this, but is it okay that if I ask a couple of questions? So in that setting, obviously, you are not going to distress the woman more, okay? In that setting, you are going to say, okay, so I'm going to give you this, the report. But before that, can I ask that, are you on your own? Okay, do you have somebody along? Okay, or do you want to call somebody along? Because I'm going to discuss a lot of things with you today. And that might be upsetting. That might be, the kind of in which you might need some kind of support from your loved ones or something. Can you call somebody in? So at that time, you are going to give her clues that something bad is coming up. Okay, but if she is like kind of calm, and if she's quiet and she's not giving you any kind of hints that she's bothered or she's very much anxious, so in that case you can take history, and you can break the news later on. But altogether, it all depends upon how role player is behaving, okay? But there is no hard and fast rule for this as well. So it all depends upon, the how the case is going, how role player is behaving, and how you want to take. Because after introduction, you should be in charge of your case, you should be in charge of your station. Rather, you should be going that how role player wants you to go. Okay, Dipti? I hope it is clear. Dipti, is it clear to you? Okay, fine. Very good. So thank you so much for Zia. So who wants to come next?
Me, ma'am.
Okay,
Monica.
Manikam. Okay,
Yes,
good, good, good. Okay, so I will give you 2 minutes to read the station, and then
Yes,
we
ma'am.
will do the history. All right, sweetheart. Where is my timer? Here it is. Okay, fine. Okay, so this is for you, and your 2 minutes start now. Okay, are you ready?
Yes, ma'am.
Okay, fine. So start now.
Hello,
Hello.
I am Dr. Monikam in the clinic today. Can I confirm your name and age, please?
Yes, I'm Eva Donald and I'm 28 years.
How do you feel now? I'm so sorry that you have severe vomiting for the past 4 days. Have you
Yes,
been?
doctor. I am just, feeling myself so weak. Um, rest, I'm fine, I'm fine. Thank
I'll
you.
ask the sister to give you IV fluids. We'll put a cannula in your arm and we'll give some sickness medication also, so you'll feel better. So that will, I have told her to come with this.
Okay,
Will
fine.
you be able to talk to me, or shall I wait till she comes?
No, doctor, it's okay. It's just like, I'm just feeling myself so weak to talk. That's it. I'm okay.
Did you have any pain? And tell me, can I ask you so that I'll be knowing more about you? If you tell in your words, if you don't feel tired, you can tell me.
Yes, doctor, I'm 9 weeks pregnant, and till 6 to 7 weeks I was quite okay. But for the last 15 days, I'm having these vomitings. But for the last 4 days, I'm just like, unable to keep anything down. So it's just like, everything is coming out. I just feel like throwing up. I just feel like, kind of having vomitings all the time. So it's just like, draining out my energies. So that's why I'm here, that what exactly is going on. Nothing is working on me. My wife gave me, the anti-sickness medications, but it's not working on me at all.
I'm so sorry to hear all this. I feel I'm able to understand that you're in severe distress.
Yes,
Do you
doctor.
pass adequate amount of urine? Is it dark colored? Is it small amount?
Yes, it is like, of small and dark yellow in color as well, but I am passing B. Yeah.
Okay. Do you have any pain in the tummy down below?
No, doctor. It's just like,
Eh,
my upper stomach is hurting now after having a lot of vomiting. That's it.
Any discharge down below?
No.
Okay. Have you undergone some scan test or blood test like that by your GP?
No, doctor. I'm due to have one scan after 1 week.
Okay. Have you ever been pregnant before?
No, doctor. This is my first pregnancy.
Mhm. Are your periods regular?
Yes, doctor.
Have you ever had some jaundice, that is yellowish discoloration of the skin and all?
Now in this pregnancy?
Yes, yes, ma'am.
No, no, no.
Okay. Did you follow any contraception before Eva?
No, doctor.
This is a planned pregnancy, no?
Yes, it is planned.
Your cervical screening, everything is up to date, no?
Yes, I had one cervical smear and that was normal.
Normal. Have you ever had any sexually shared infections? Sorry to hear ask this.
No, doctor.
Are you aware of your weight to height ratio?
Yes, it is 26.
Have you lost so much of weight in this 15 days?
I feel weak, but I don't know whether I have lost or not.
Are you aware of your blood group?
Yes, it's O positive, doctor.
For any other medical condition you are getting treated by GP, and are you on any other medications?
No, doctor.
You're not on any medication.
No, no, no.
Are you allergic to any medicine?
No, doctor.
Have you ever undergone any surgery on your tummy or down below?
No.
Have you ever had any family history of any concerns, clots, or cancer like that?
Not I'm aware of.
I'm sorry to ask this. Please answer me. Do you have any personal habits of smoking or drinking alcohol or taking some recreational drugs?
No, doctor, not at all. I'm just like, kind of party drinker, but since I'm pregnant, I'm not drinking anymore. I'm avoiding as much as
Okay,
possible.
very good. I'm really appreciating that.
Mhm.
Uh, you're living with your partner, no?
Yes,
Is he supportive?
yes, doctor, he is.
Okay. Are you well at home?
Sorry.
Are you well supported at home?
Yes, yes, he's supportive. He's
Mhm.
very loving, and he's
Okay.
also very upset because I'm not eating anything.
Do you
So
feel down, depressed, or very anxious for the past 4 months? I'm sorry, 4 weeks.
yes, actually, for the last 2 weeks, I'm very upset because I'm throwing up all the time. I'm not eating, so I'm really worried that what will happen to me and my baby. What is going to be the treatment and management.
Any such feeling of depression in your family? Anybody having such a feeling of
Mm,
depression or
No,
any
doctor.
mental health problem? Nothing.
No, no.
Anything else you want to add, Eva?
No, doctor. That's it.
It is, you have a condition of nausea and vomiting of the pregnancy. Have you undergone this pregnancy hormone level test and all? No, never.
No, doctor.
Okay. This is something more than that. Not simply it's nausea, vomiting, and of pregnancy, but it can be hyperemesis. We have to compare the weight loss and we have to run some tests also, so that to find out the serum electrolytes and all. That is the amount of some chemicals in the blood, sodium, potassium, chloride, all this we have to measure and
Okay,
see
fine.
whether some chemical called ketone is present in the urine as well as more in the blood.
Okay, okay, fine.
Uh,
Okay,
one more.
Manikam, your history is over. Thank you.
Thank you, ma'am.
Okay, fine. So, what do you think about it? Because it was a very straightforward kind of, the history that she is having vomiting. So she has told you that she is 9 weeks pregnant. So in
Ma'am,
9 weeks pregnant, what exactly can be the, the causes of the, the pregnancy,
you have
vomiting?
to rule out, ma'am,
Yes.
hyperemesis gravidarum, molar pregnancy, and
Yes, molar pregnancy, number one.
multiple pregnancy, ma'am.
Very good. Multiple pregnancy. And what else?
Acute gastroenteritis
Very
or
good.
gallstones leading to pancreatitis.
See, sweetheart,
Still
we have
associated with pain,
to,
ma'am.
for the vomitings, for the early pregnancy problems, okay, vomitings, pain. So what we can do is that we can divide it into two parts, okay? We can divide it into, the obstetrical condition and non-obstetrical condition, obviously. So if we talk about obstetrical, so yes, molar pregnancy, multiple pregnancy, okay, then it can be acute gastroenteritis, it can be acute UTI, it can be pancreatitis, it can be anything. So for that, what you have to do is in pregnancy, we are much more concerned with UTI. We are much more concerned with vaginal discharge. So I think you didn't ask about that, okay?
I asked
So
about
you have
discharge,
to.
ma'am. I didn't ask about
Mhm.
dysuria, ma'am. Sorry, ma'am.
Hmm. Okay. So you have to be very, the specific in this thing.
Yes, ma'am.
Uh, and, like I said earlier, that your history should be very crisp and your history should be very structured as well. So you said in the start that I will ask my sister. Don't use sister, okay? This sister
Okay.
word we use in our countries, okay?
Oh,
But
sorry, ma'am.
sometimes we have to say that I will ask one of the staff nurse or I will
Staff
ask one
nurse.
of the midwife to come
Mm.
and give you anti-sickness, the medications.
Mm.
But if she's telling you that I'm okay now, I just had this problem, so you can even forget it, okay? You can
Yes.
not like kind of explain on this thing that I will put you on the IV fluid, I will ask, and I will give you anti-sickness medication. So this way you are losing your 30 seconds, 40 seconds.
Oh,
Okay,
yes,
unnecessary explanation. So don't do that. Okay. Apart from that, you have used 2-3 times, I'm sorry, I'm sorry. Why are you sorry? She's having vomitings, and by a clinician, we know, okay, we can say that I understand that you are going through tough situation because you are not, you are unable to keep anything down for the last 4 days. And certainly, you're feeling weak. You can just, the kind of acknowledge, you can just kind of say, you can say that I can understand you are going through a lot, I can understand, I can feel your pain, I can understand that you are having a bad time, okay? So this is how you can just say. It's not like that this is your fault, that I'm sorry you are having vomitings. Why? Okay. Unless you
Okay.
think that, you have to say sorry, in that case, you will say only.
Mm.
And in terms of vomitings, so for vomiting, for the pregnancy, she's 9 weeks pregnant. So you asked about the pregnancy in the end, although this should be in the beginning. That is it a planned pregnancy? Is it spontaneous pregnancy? If you could have asked, so she
Mm.
should have told you, she would have told you that, okay, I conceived through IVF.
Oh,
Okay,
oh,
because I
big
had
thing.
problem. So in
Mm.
that case, you can think of, even multiple pregnancies as well. So
Mm.
probably because we know the nausea, vomiting, or hyperemesis is because of molar, because of multiple pregnancy.
Yes.
So that's why I always say it should be very structured. If it is
Mm.
pregnancy, you will talk about that. How far are you in your pregnancy? She's telling you I'm 9 weeks. Okay,
Mm.
perfect. So can I ask that how have you been for the last, these 9 weeks? I can see that you are having this problem that has, increase in severity for the last 4 days. And before that, were you okay? Yes, doctor, I was okay. Is it a planned pregnancy? Yes, doctor. Is it spontaneous or with the help of any medications? No, doctor, I conceived through IVF. Okay, okay. So you will acknowledge, you will,
Yes.
stop and you will just think, and you will
Mm.
show your thought process to the examiner that, okay, now you are coming to the conclusion that why
Mm.
she is having hyperemesis. She can be having multiple pregnancy. Then while you will come to the management, then you will say that, okay, I would like to have tests on you. I would like to have, the ultrasound on you because you have conceived through IVF. So probably, you might be having, the twin or the multiple pregnancies as well. Okay. Or
Okay.
in case, you can say, multiple pregnancy, or you can say the twins, or whatever you think. But yes, you have to show the thought process to the examiner as well. Then you ask about regular periods. What is the connection of regular periods over here when she is telling you I'm 9 weeks pregnant? Don't unnecessarily ask. Okay, cut
Okay.
it down.
Mm. Mm.
Then you asked about contraception. What is the
Mm.
role of contraception over here? She is pregnant now.
Okay, ma'am.
Okay,
Okay,
so
ma'am.
you will cut it down, sweetheart. Sexually
Yes,
shared
ma'am.
infection, no need to ask in
Mm.
this. Okay, sexually shared infection, yes, it is going to be important in the case of, if it is a case of STI, if it is a case of cervical, the problem, if it is a case of any other thing. So yes,
Mm.
that's going to be important, but not in the ops case when she is here for vomitings. It
Okay.
means, you are losing time in terms of, if it is 10 minutes station, so you
Mm.
are taking 6 minutes to history and then another 2 minutes for the investigation and explanation, and then you are managing this case in 2 minutes. It means, Nana, you're not going to complete this station in 10 minutes at all. Okay? So you have to be very quick that,
Yes.
what exactly you have to ask in your questions. In terms of allergy, it was okay. Rest of the history was okay. Family history, you can cut it. I mean, you can cut short if you are not very much concerned, because these are vomitings and there is no family history of vomiting. Okay, so you can even cut this thing short as well. And jaundice, yes, you asked. I want to emphasize on one thing, because we have just said that the pregnancy specific conditions and the non-pregnancy specific condition
Yes,
as well.
ma'am. Mm.
Okay, so you will ask about, I mean, did you have any fever? Did you have any kind of the
Mm.
waterwork problem? And how about your the bowel habits? Are they
Mm.
normal? Is there any history of the lower tummy pain? Is there any history
Mm.
of discharge? Is there any history of the bleeding down below? Because the vomitings, because early pregnancy problem will have 3 or 4 symptoms: pain in lower abdomen, okay, bleeding,
Mm.
and this vomiting. So
Yes.
obviously you have to exclude so many things. You have to exclude ectopic, you have to exclude the multiple pregnancies, you have to exclude molar pregnancy, you have to exclude a lot of things. Okay, you got my
Yes.
point. So this
Yes,
is
ma'am.
how you can just cut your the
Mm.
time, these sentences, unnecessary sentences. And yes,
Mm.
you asked about, are you passing adequate amount of urine? I think this is bit the kind of like, I mean, kind of medical term rather than
Okay.
the patient friendly language. Okay,
Mm.
so don't
Mm.
use this. Later you have compensated, later you have asked that, are you passing the how about your the B? You can ask about this. How about your urine? I mean, okay, you can
Mm.
ask about
Mm.
this. So I mean, and so color you mentioned, that is okay. And that's it. So I think it should be structured, but well done altogether that you have
Thank you.
tried. And even trying, is a very big thing. So I
Thank you,
will
ma'am.
definitely encourage you to present more, to study more. You are a very good student. All you
Yes,
have to
ma'am.
do is that you have to be structured. Okay, Manika?
Yes, ma'am. Thank you, ma'am.
Okay,
Thank you,
sweetheart.
ma'am.
Okay.
Thank you
Very
for your
good.
kind words and the opportunity, ma'am.
Always there, always there. Okay.
Yes, ma'am.
Okay, great. Anything else anybody would like to add? What are your thoughts about this history?
Anything about quality of life? Should I ask?
Yes, you can ask. You can ask. Okay. So quality of life is okay, and you can just how you will ask. Okay, let me ask you how you will ask about quality of life.
I can understand that it has affected your quality of life. I can understand like that because he's already discussed from our
Yes.
expression.
So how you are going to ask about quality of life? See, you are telling yourself that she is distressed, okay? And anybody who is coming with a lot of vomitings, definitely be in, the distress or upset. And she's telling you, and she's, giving you expressions that I'm in pain and I'm, difficulty in talking to as well. I'm just, generally weak. So this is telling you, this is giving you hints. But rather, if you really want to ask about the quality of life, in fact, then you can ask that, I understand that, it must be troubling you a lot because, you can't keep anything down. So, I mean, is it affecting you, I mean, in your, the work, or if you are working, or if you are, working at home as well? So, yes, doctor, I feel myself so weak. I understand. It must be like, troublesome period for you. Okay. So this is how you can just, show your emotions that you understand that if somebody is going through a lot. Okay.
Yes, madam. Okay.
Okay, great. Very good. Anything else anybody would like to add? No? Okay, that's very good. It means like, we are cleared about that early pregnancy problem, that if somebody will come with early pregnancy problem, what exactly we are going to ask and how exactly we are going to approach. And remember, and please remember this thing again and again and rehearse while you are practicing that you have to take history within 5 minutes. Okay, within 5 minutes, ideally within 4 to 5 minutes. That's it. Okay, perfect. So who wants to come next? Who wants to present? Thank you
Okay,
so
ma'am.
much. Thank you so much. Okay. Yes, please. Okay, fine. Yes, let me show you and let me start the timer for you as well. Just 1 minute. Okay, so this is a case for you and let me start the timer for you. Okay,
Me, ma'am?
start. Yes, you.
Okay, ma'am.
Okay. 2 minutes. Okay.
Hello, I'm Dr. Abdul Qadir, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yes, I'm Mary Clark and I'm 18 years.
And how do you like to be addressed?
Mary is fine.
Okay, Mary. I understand from your note, Mary, that you are pregnant now about 8 weeks and you are coming today as your booking visit. I'm right.
Yes, doctor, exactly. I'm pregnant, and that's why I'm here to discuss about, because I know I'm a case of cystic fibrosis. So I really want to know that, how it is going to affect me, my upcoming baby, and how this pregnancy is going to, deal with me. That's why I'm here.
Yeah, of course. Yes, but please, would you allow me to ask you a couple of questions before answering all your concerns?
Yes, doctor, sure. Why not?
Okay, Mary. If this is your first pregnancy,
Yes, doctor, it is.
are you sure of your last menstrual period?
Yes, that was exactly about 8 weeks ago.
Yeah, it is always regular?
I mean, usually because of my problem, so sometimes it was kind of irregular. But I remember I had my periods 2 months ago.
Okay. Do you perform any dating scan yet?
No, doctor, I am yet to do after like 2 weeks.
Okay. All right. You come for booking visit. Is the midwife taking any blood investigation, any blood samples from you?
No, doctor. She said it's better that if I see a doctor.
Okay. Yes. Is this pregnancy was planned pregnancy?
No, doctor. In fact, it was unplanned, but I'm happy to continue.
Okay. What are you using for a contraception?
No, I was not using anything, in fact.
Yes. Okay. All right. Do you know your blood group, Mary?
Yes, it is A positive.
Do you know your height weight ratio?
Yes, doctor, it is 27.
Okay. And how are the things that going till now?
Actually, I mean, I just, because of my illness, I do feel myself, the weak because of the medications I'm on. And sometimes I do feel that, this pregnancy can be, the kind of stress, but really, I really want to continue, this pregnancy. So
Yes.
that's what I'm here to discuss more about this.
Yes. Could you please tell me more about your medical condition?
Like,
Could you tell me how you discover it, and or it is since birth?
Actually, it got diagnosed when I was like, 7 years of age, and
Yeah.
I'm living with it, and certainly, I have some kind of ups and downs with this. Sometimes I do have to go to hospital. Sometimes, I have to be in hospital for like, couple of days as well. But yes, I'm managing well. I'm on, plenty of medications. I do take, the nebulizers, inhalers, everything, and I am trying my best to keep myself in a good, the health.
Are you regularly follow up with your physician?
Yes, doctor.
Could you tell me more about the medication you are taking for?
There are plenty of medications, doctor. Yeah, I'm
Could you
taking,
tell me, yes, the most consistent ones you are, and if you are still taking during pregnancy?
Yes, I am taking.
Yeah. Could you name the drugs for me, or is this
Yes,
difficult for you?
doctor. They are no. They are like, kind of the drugs. One is the antibiotic, and I am on the regular antibiotic. And the doctor said I have to take it, and the name is colistin. And the second thing I am taking very regularly. It is like, kind of thinning of the sputum. I do use nebulizer as well, and sometimes if I am having a lot of breathlessness, so I do have to take steroids too.
Yeah. Do you I mean, take the opinion of your physician about your being pregnant?
No, actually, he was, the kind of against getting pregnant. But I'm so excited because, I didn't tell him so far, and because I'm so excited for this pregnancy. So that's why I came to hospital to book myself.
Yes, sure. Oh, of course, I appreciate that, and that you want to come early for booking, and you want to be in the best shape during pregnancy because, of course, of your medical condition. But I think you agree with me. We have to counsel your physician about being pregnant while you have this medical condition in order to take his advice into consideration. So would you
Okay.
allow me to refer you to and to take his consultation about that?
Yes, doctor, why not? Because I really want myself
Okay,
and my
thank you.
baby to be in good
Yes,
position.
yes, thank you, Mary, for that. Do you have any other medical condition apart from that cystic fibrosis?
No, doctor, I think this is enough.
Yes, sure. Do you perform any surgery before in your tummy or anywhere else?
No, no, doctor.
Are you allergic to any medication or anything?
No, doctor.
Please, what about your social habits? Do you smoke?
No, I am strictly not smoking because of my health.
Yes. Yeah, sure. Drinking alcohol?
No, not at all.
I'm sorry, I beg your pardon. Any recreational drugs?
No, not at all.
Okay. With whom are you living, Mary?
At the moment, I'm with my partner.
Do you feel supported at home?
Yes, he's quite loving, quite supportive.
Yeah. Okay. And he's happy like you about that pregnancy too? Yeah.
Yes, actually, we both are very much excited.
Yes, nice to hear that. Nice to hear that. Okay. Do you have any family history of similar condition like cystic fibrosis?
Actually, my one of the maternal uncle, he has cystic fibrosis as well.
Yeah. Yes. Okay. And do you have any past history of concern regarding your medical condition you want to talk to me about?
No, doctor. No.
All right. I want just to ask, in the couple of weeks before, do you feel down, depressed, or lack of interest, or?
In fact, not depressed as such, but I'm just anxious about my pregnancy. That's it.
Yes, and I think you know that because cystic fibrosis, a disease that it is inherited. So we will refer you for a genetic counseling in order to explain to you about that condition, its relation to your baby. Is that okay with you?
Yeah, sure, doctor. Why not?
Okay. Do you start the folic acid yet or not?
Yes, I did.
Okay. All right. Okay. Anyway, thank you for those information that you are sharing with me, Clara. And now I'm going to I'm ready to answer all your concerns. Okay, Clara.
Fine, doctor. Okay, fine. Thank you so much.
Thank you, Mary. Thank you very much.
Thank you. Okay, Intisar, how was it?
I don't know, ma'am. I feel mental block. I don't know why. I feel that questions are running away from me.
Although you speak very beautifully, you have got a very good tonal quality. All you have to do is that you have to be very specific. Okay, now we will talk in the terms that about the cystic fibrosis. So what exactly are the consequences if somebody with cystic fibrosis is getting pregnant? So what are the specific questions you will talk about?
Yeah, of course, I would like to know if her husband also has any similar condition like that. And because I have to refer her for genetic counseling, both her and her husband or her partner. Because of course, in order to be able to explain to her that the possibility that the baby or the possibility the baby will catch the disease after birth. So I think this is very important, as well as her condition secondary to the disease. If she is in a good condition, or is she is actually in that condition, she entered into the hospital many times, she admitted to the hospital about her lung condition, about her bowel condition, and I mean the implication of the disease upon her and upon pregnancy, and
Exactly.
the implication
Now
of
you have
pregnancy upon her condition.
exactly. Now you have come to the the point that exactly you have to divide cystic fibrosis into two domains basically. Okay, how
Yeah.
cystic fibrosis is going to behave in this pregnancy, and how pregnancy is going to affect cystic fibrosis. Okay, in
Yes,
terms
ma'am.
of cystic fibrosis itself, you will ask the specific question. You perfectly said that you have to know about husband because this is genetic condition. Then obviously you have to exclude that whether his husband or her husband is also the carrier or not, because in that case she is having cystic fibrosis, then yes, certainly we do need to involve the genetic counselor as well. Okay, apart from that, in terms of cystic fibrosis, she's telling you herself that sometimes I do have to visit hospital, sometimes I do have to be in the hospital as well. So at that point you will understand that okay, she is having complications of cystic fibrosis. Okay, because she is coming, she is getting admitted. So you will ask there and then that, okay, is it a normal hospital admission in the ward or in the ICU as well? Because that is going to give you the severity of the cystic fibrosis as well at that point. Okay.
Yes,
And
ma'am.
because she is 8 weeks pregnant, okay, so we know that the pregnancy can have deleterious effect on cystic fibrosis, but we are not going to offer the termination of pregnancy there and then. Okay, we can say that cystic fibrosis, that the dealing of the cystic fibrosis, the management of the cystic fibrosis can be a bit challenging in the pregnancy, because pregnancy itself has the many problems. Because in the pregnancy you may have some kind of the increase in the short of breath, you may have some kind of respiratory problem, breathing problems, you may have some kind of the GI problems, and you have to ask about GI problems as well in cystic fibrosis. Okay, in terms of the diarrhea, in terms of constipation, in terms of the indigestion as well. Then yes, you will ask about that. She told you herself that she conceived herself, but we know that in cystic fibrosis the chances of having the spontaneous conception are quite low, and that can be
Yeah.
because of disease, that can be because of the medications. Okay. One thing I want to tell you, Intisar, don't put so much time on knowing the medications. This is not your domain. Okay. What you will do is that you will sum up. Okay, you will sum up. You will just say that I understand that you are on a couple of medications, but it is better that I would like to know more from your doctor, that who is treating you. So I will get in touch with your doctor as well, that because certain medications are to be taken in the pregnancy, and certain medications are need to be switched, and certain medications we need to change altogether. Okay.
Yeah.
So I would
Yeah.
like to know the more about your medications, and I would like to have a consultation with your the cystic fibrosis doctor as well, because we at all the points, or at all costs, we want you to be in good health. Okay, because
Yeah.
with the cystic fibrosis, because in the pregnancy what happens is that normally the women who are not having any the breathing issues, in the normal pregnancy the woman can have some kind of breathing issues, the woman can have some kind of indigestion as well. And if already you are having these breathing issues, so yes, I mean this can the trouble you in pregnancy too. Okay. Apart from that, because of the medications, you can be at risk of the development of diabetes. So we might be having the couple of the extra checks on you, in terms of that, because we are very much concerned about your health as well. So we have to talk about the diabetes too, because GDM can be the complication of cystic fibrosis. Okay, and plus the miscarriage, plus preterm labor, plus the frequent hospital admission, plus frequent hospital admissions as well. Okay, so at all points what you will tell, and that is going to be in the management. But in terms of history, I must say that you have to be very crisp and very specific. Cystic fibrosis, you will talk about 3-4 things. Okay, the breathing problems at the moment, because it will exaggerate because of the pregnancy. You will talk about the hospital admission, indigestion. You will ask about the pregnancy. Is it a spontaneous pregnancy, or you took help with the help of medications? That is very much important. Don't ask about LMP or the regular periods. She is 8 weeks. Okay, take it as 8 weeks. No need to inquire about the LMP. Okay, all of you, please be extremely careful. If she is telling you, if it is not written in here that, and she is not telling you She can tell you that, okay, I had my last period for about like 2.5 months ago, and I just got checked that I'm pregnant. Okay, so in that case, you might take help from the ultrasound, or you might take help from the beta HCG as well. But that is a very rare possibility in real exam. I myself have never seen a single case, okay, so far in my life, 3 years of teaching as well. And plus, now I'm examiner too. So I don't see, so many things in real exam. If it is written 8 weeks, take it as 8 weeks. If it is written 13 weeks, take it as 13 weeks. No need to go and recheck the gestational age, okay? So save your time. In terms of
yes, ma'am. I'm sorry, ma'am. Because as you said, ma'am, that cystic fibrosis usually affect fertility. Yes, it is more than men than in women, but that's because she said that it was unplanned. So I think maybe I have to recheck the last period, because it is maybe this is not calculated well by her. That's what I think.
But I will again say, if it is written in the question, she is now.
Yes, I have to take it like that. Yes, ma'am.
Yeah. So take it like
yes,
that.
sure.
Okay? So this is what I want to emphasize on, because this is how.
Yes, ma'am.
Because even the examiner is going to help you with this. Is that she is 8 weeks. Okay, take it as 8 weeks. Now tell her what cystic in terms of management, we will talk about it. In terms of the history, husband history is very much important. Okay, family history is very much important, because we know it is an autosomal recessive disease and it tends to skip generation, and yes, it will show up, okay, at any time. So yes, husband should be screened, family history should be asked, past history of the medical the illness, past history of hospital admissions in terms of cystic fibrosis, that should be asked. In terms of drug history, yes, you very well asked, but don't put so much emphasis on knowing the medications. Okay,
yes,
because this is not our time. Okay,
okay,
so you pretty well lost precious 1 minute. So if you could save that 1 minute, so I think this is going to help you in terms of management later on.
Yes,
okay, then you asked about dating scan. See, sweetheart, she is 8 weeks, so yes, dating scan is going to be 10 weeks. Yeah, okay, so don't unnecessary the ask, because she is in booking visit now. So you will say that, okay, but for the the medical condition, somewhat like thalassemia, we have to do early scan. Sickle cell disease, we have to do early scan. Yeah, 7 to 9 weeks. So probably in this cystic fibrosis, you will say that it's better that I will book you for urgent the scan, just to know how your baby is doing inside. Okay, how the baby is doing inside. So it is a very the generalized term, rather than you will say that have you had any booking scan or no, because this is a very crucial condition. Okay, because we are very much concerned about early miscarriages, we are very much concerned about later on preterm labor as well, and that can be touched in the management. Then you asked about family history was okay, allergy history was okay, medical history was okay. Altogether, I think you can do much more better than this, because I can see the potential in the SAR. Okay, so I think you can present, and you can do a bit more, because you know how to speak, and you, mashallah, you speak very beautiful. Okay, so keep on rehearsing, keep on practicing the stations, and that's it, you are good to go.
Okay, ma'am, thank you very much, ma'am. Thank you, ma'am. Thank you.
Okay, welcome, sweetheart. So any other comment for this history taking? Anything which can be added, anything which can beautify the station?
Dr. Zaib, regarding personal habits like smoking and drinking alcohol, do we really need to signpost? Like, I need to ask you a few intruding questions.
Let me tell you one thing very interesting. I never use this phrase, because I myself, don't find it is very much intruding. What so much is intruding in this? This is a kind of social norm, and in the Europe, in many countries. So, I mean, you can say, don't signpost. Intruding, I think intruding is bit, the kind of a word which is kind of alarming. You can say, can I ask you some personal questions? So I think that is bit okay, rather than intruding questions. Okay, I never signpost. I myself never signpost. Trust me. Okay.
And one thing, like in agenda, that agenda becomes very big if we tell her, I need to ask you a few questions, then I may need to examine.
Exactly. So, okay, let me tell you in this case, for the cystic fibrosis, for example, if I am the candidate, I will enter into the cubicle and I will say, hello, good morning. I'm Dr. Qureshi, one of the doctors in the antenatal clinic today. Can I cross check your name and age, please? Yes, I'm Mari Clark and I'm 18 years. Okay. So can I call you Mari? Because she's young. So you will say yourself, can I call you Mari? Yes, you can, doctor. Okay, Mari, how are you doing today? Yes, I'm doing good, doctor. So Mari, I understand that you're pregnant and you are 8 weeks in your pregnancy. Is it that so? Yes, doctor. So she will tell about herself yourself. Okay, so she will tell that I am cystic fibrosis. Okay, so you will say all right, and deep down we know that cystic fibrosis will have so many consequences in pregnancy. But yes, we are not going to show. We are not going to offer her termination at first place. We are going to give her all pros and cons of everything. We are going to tell each and everything. Okay, we are going to tell that okay, this way if this happens, this will happen if in terms of management. But while you are setting the agenda, then how you will say, then you will say, I understand that you are having cystic fibrosis and you are pregnant as well. What I'll be doing is that I'll be asking you a couple of questions, then I will take help from the your cystic fibrosis specialist as well. I will involve my consultant too, and in the end I will try to give you the all information how cystic fibrosis is going to behave in your pregnancy and how we are going to manage you. Okay, apart from that, is there any concern, Mari? Is there anything specific you want to ask today? Okay, so this is how you can just say, I don't think that you have to examine in the presence of chaperone for every patient. No, I don't like it at all. Okay. Personally, if you ask me, that I would never say that I would like to examine you in the presence of chaperone until and unless that I really have to examine the patient. Okay. That is the agenda. Because in some cases it is written outside that examination findings will be provided to you. Okay. So if you will say that I will examine you, then yes, examiner will show you examination finding. But that is a very rare possibilities in I must say in structured discussion rather in the simulated patient tasks. Okay.
Yes.
Okay.
And
Great.
regarding blood tests can report to all antenatal cases, like in one sentence we can ask together, like what about your blood test and scan report? Is that
I don't
okay?
ask. I don't ask like this. I ask like this. Okay. Have you had your bloods and the scans done? That's it.
Okay.
I ask this way. Everybody has different, the kind of way of speaking or something. Personally, I speak, like this, and this is how I deal, and this is how I coach to my all candidates as well. Be simple, be very specific. Don't follow anybody. I mean, invent your own sentences. Be your own judge. Be, I mean, your own critic as well. That how you can improve, how you can simplify things. Because in the end, what exactly we want is we want our message to be conveyed to the patient, and our patient should be very much satisfied with us as well, that by the end he or she will give us 2 marks, that okay, yes, he wants to see us in the future too. Okay.
Yes.
Okay, great, 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 very good, very good. So who wants to present next case?
Me,
I
ma'am.
will present, Dr. Zaib.
Okay, so who's this, can I ask?
Yeah, I'm Dr. Swati.
Okay, Swati. Yes, fine. So Deep said that he or she wants to present as well. Aina too. So yes.
Yes, I am here.
Okay,
Yes,
fine. So
yes,
Deep,
yes.
okay,
I
fine.
wanted to present.
Okay, okay, Aina. So okay, fine. I will bring another case. No problem. Okay, fine, Swati. This is for you.
Okay, no problem.
Yes.
Let me give you 2 minutes and then you will start. And remember, we just have to take history. Okay, we don't have to manage. For management, I will try to take another session probably. Okay, great. Start. Okay. Ready, Swati?
Yes.
Okay, dear. Yes, start.
Yeah. Hello, I'm Dr. Swati, one of the doctor in the gynae clinic. May I confirm your name and age, please?
Yes, I'm Flora Ricci and I'm 28 years.
What you want me to call you?
Flora is fine, doctor.
Flora, nice to see you.
Thank you, doctor. Nice to see you too.
From your notes, I understand that you had a scan done and you are here to discuss about the scan report and you are planning to have a baby. Is that correct?
Yes, doctor. I am really, hoping to start my family. I really want to know, how, you can help me because I know I'm having fibroids and everything, but I really am, hoping to start my family. So please help me with this.
Surely, Flora. In few minutes, I will answer all your concerns. But before that, can I ask you a few more questions to know more about you?
Yes, doctor. Sure. Why not?
So, Flora, can you tell me what are your complaints right now?
At the moment, not as such, but I really want to know that, like I said, that I want to start my family. So I really want to know that, what are going to be my options and how it is going to be possible.
Yes, sure, Flora. I will tell you in a moment.
Mm-hmm.
Can you tell me more about your periods?
Yes, doctor, my periods are like, regular, but they are heavy. And sometimes, they are with clots as well. And sometimes, I am having, the pain as well. Sometimes they are like, for 7 to 8 days, sometimes for 10 to 15 days. But, altogether, I am just like, living with it because I am having this problem for the last 2 years.
Oh, I am so sorry to hear. I understand that it might be very difficult situation for you to cope up with this heavy period. Have you tried anything before?
No, doctor.
Is it affecting your daily routine work?
Yes, it is.
Do you feel dizzy or giddiness?
Sometimes, doctor, I do.
Okay. Have you taken any treatment before for this?
For fibroid?
Yes, for your heavy periods.
Yes, I am on capsules. The doctor gave me earlier, and tranexamic acid, I believe. So I do take it on and off, and I'm having heavy periods.
Despite of tablet, you have heavy periods. Is it?
No, no, no. It helps me in heavy periods.
Okay. Have you ever been pregnant before?
No, doctor.
Okay. Flora, I need to ask you a few personal questions regarding your sexual history. Is that okay?
Mm-hmm. Yes, doctor. Sure.
How many times do you have intercourse in a week?
It's like once or twice.
Do you have any difficulty during sex?
No, doctor.
Any bleeding after the sex?
No.
Any bleeding in between your periods?
Not exactly.
You are you up to date with your cervical smear?
Yes, I had one, and that was normal.
Okay. Uh, are you on any contraception at the moment?
No, doctor. I'm really hoping to start my family, so no, not exactly.
All right. Do you follow up with GP for any medical condition?
No, I just, see him, just for this heavy periods, and that's it.
Yeah, regarding any operation in the past on your tummy or down below?
No, doctor.
Are you on any medications at the moment?
No, not as such.
Any allergy to any medicine?
Yes, I'm allergic to, this benzyl penicillin.
Okay, I will note it down so that we will avoid this in your case. Regarding your family history, anything of concern you want to tell me?
No, not exactly, doctor.
Regarding your personal habit, do you smoke?
Occasionally.
Do you drink alcohol?
It's like, I'm party drinker.
Mm-hmm. What you do for living, Flora?
I work as a the school teacher for the but it's really the causing me trouble. It's really affecting my life. Sometimes because I'm bleeding heavily, I do have to change my pads quite often. So obviously it does hamper my activities as well.
Oh, I'm so sorry to hear. I really understand it is very troublesome, and I will try to help you at my
Yeah,
best.
sure, doctor, sure.
Uh, how are the things at home?
Everything is fine, and I live with my partner, and he's quite supportive, quite loving. So that's why we are hoping to start our family, and for in upcoming 1 or 2 years we are planning to get married as well.
Yeah, I appreciate it. Can I ask you a few
Thank you.
questions about your partner?
Yes, doctor, why not?
Is he fit and well?
Yes, he is.
Is he taking any regular medicines?
No.
Okay. Does he smoke?
Yes, he does.
How many cigarettes?
Sometimes, he I'm not like kind of certain, but I think 5 to 6.
All right. So let me tell you, smoking is injurious to his health as well. So if he want, we have a very good NHS smoking cessation services. So if he is interested, we can refer him to them.
Okay,
Does he
doctor.
drink alcohol?
Sorry?
Does he drink alcohol?
Yes, doctor, he does.
How many drinks in a?
I think 2 or 3, which I'm aware of.
Okay. If he is interested to cut it down, again we have a
Have you
NHS
talked to
services.
him? Okay,
Yeah.
fine, doctor. I'll talk to him.
That will also this will help for your planning of a baby. Cutting down
Okay,
the smoking, cutting down the drinking will definitely help his sperm quality as well.
okay, fine, doctor. Sure.
Any operation in the past for him?
No, not I'm aware of.
All right. Regarding, have you ever suffered from any sexually shared infections
No, not at all.
for your partner?
No, doctor.
Yeah. All right. So thanks for sharing your information with me, Laura.
Okay, thank you, doctor.
Yeah. Thank you.
Okay, Swati, how was it?
Yeah. Regarding partner, I need to ask in detail, but I took more time in history, so
Yes,
I couldn't.
you took almost 7 minutes, okay, for taking
Yeah.
history. So I think this is too much.
Yes.
What you can do to cut down your history? What can be left, okay, which was unnecessary, okay? Your target should be, she's 28 years. She is pretty young, okay? She's having uterine fibroids and now she's planning to start her family. She seems to be very anxious and have many questions to ask. Her recent scan shows 5 centimeter submucosal fibroid at fundus and small subserosal fibroid of 2 centimeter. Okay, we can forget about it, okay? We are just concerned about this. So yes, in terms of your history should be focusing on, she's planning to start her family. She's not like that she is unable to conceive. Okay, if she is unable to conceive, in that case you will dig in more of the detail of the subfertility. But she's planning to start a family, and because we are practitioner and we know that 5 centimeter submucosal fibroid can cause problem. Okay, and she's having HMB as well, so you will explore more HMB. Okay, you will explore more about this thing as well. You can say then later on that, okay, once you are in good position and you really want to know more about the this fibroid and the other things as well. In terms of fibroid, what exactly do you want to ask more? In terms of bleeding, okay, you will ask about bleeding. Then what else do you ask?
If it is heavy period, is she anemic? So is she getting tired and dizziness? How many pads she is changing in a day? to point out the severity of the bleeding. If she is passing clot, then is she flooding at the night anytime there was flooding episode?
Because for the submucosal fibroid, you have to propose your yes, dysmenorrhea, because submucosal fibroid are very much the bad. In fact, they are very bad fibroids because they are going to be into the endometrial cavity. So sometimes if they are there, so yes, I mean they can cause many problems later on. Okay, so you have to tell her that it's better that your submucosal fibroid needs to be treated. So this is how we can because if you sometimes it happens that you conceive with it, and if she is having normal cycle, she is having heavy bleeding, but she is having normal cycle, it means then you have to ask about this thing. Obviously you ask about coitus, that was okay, and then moreover you can stress on such cases that okay, we need to do, because this was like kind of history, so you will just talk about histories as well. You will talk about HMB, and you perfectly said that you will ask this question. Then yes, okay, history of hospitalization, history of previous treatment, history of when was the last period. Okay, then you will ask about the past surgical history, past medical history, and later on obviously you will propose the management, and then it is going to be the management. Okay, in terms of history, then yes, you will just ask about this, plus you will ask about the previous conception as well, and what else, the partner, and is it a stable relationship, because she is saying that in the next 2 years we are planning to get married, and we are planning to start our family as well. So yes, this is going to be the kind of the history. So I think you did justice, but you can cut. I think you misinterpreted this station as a station of the infertility. So probably that's why you went into much more of the detail. Okay, the question is, she is planning to start her family. She seems to be very anxious and have many questions to ask. Okay, moreover, if it is a 10-minute station, so probably in the management she will dig out more that what exactly this fibroid can cause to me, and if I become pregnant, what will happen. Then you can talk more about red degeneration of fibroid. Then you can more talk about the frequent admission, hospitalization, IV fluid, blah blah blah, and everything. Okay, so the idea for such cases that you should be very well the words with how you will initiate the your station, how will you will initiate the talk and the discussion and the history taking. Okay, clear, Swati? But I think you can speak. You know how to start, but I think you are feeling difficulty in just how you will start the station and how you will say, because you are taking few seconds to just ask the questions. Don't do that. Okay, just look confident, because that how to take history. Just rehearse more, rehearse with your study buddy if you have any, or rehearse with yourself, doesn't matter. Okay, and please cut down to history too. Don't ask unnecessary questions. All right, you asked about that in terms of, just let me correct you, for the partner you said that smoking is injurious to the health. Later on you got a very beautiful sentences. I was hoping that rather injurious to the health, you will talk about that yes, the smoking has some kind of effect on the sperm parameters, so it can cause some kind of problems on the sperm quality, quantity as well. So it's better, it's a good idea to stop smoking and to stop alcohol as well. Okay, but that moreover is going to be when the couple is coming to you, they are unable to conceive, they are they are having scans, and now almost all tests done, and now they are here to discuss about this the reports, and then there is male factor, or it is unexplained, and blah blah blah. So in that case, moreover, you can say, but I think injurious to the health is quite the kind of phrase not to be used. Okay, Swati, so I will say that it's better not to use this. Rather you can kill that why smoking should not be done. Okay, why alcohol should not be consumed. That's it. All right.
Yes, thanks a lot, Dr. Zaib.
Okay. Any comments for history? Anything that can be added? Anything else? No? Okay. So who was next candidate? Sudeep, are you there?
Me, I was the one.
Aina? Yes, yes. I will ask you. Sudip. So Intasar is done. Manikam, Fauzia, and Swati. Okay, Sudip. Let me give you next session. Okay. So take your 2 minutes. And remember, you just have to take history. You don't have to manage the case. All right?
Sure. Sure.
Okay, fine. Great. Take your 2 minutes and your 2 minutes start now.
May I start, madam?
Yes. Okay. Start.
Hello, I'm Dr. Sudeep, one of the doctors in the labor ward. May I confirm your name and age, please?
Yes, I'm Susie John and I'm 28.
Okay. What can I call you?
Susie is fine, doctor.
Oh, sure. What is your problem?
Actually,
know?
doctor, I'm in labor and I came here and my labor got started in the morning. And when I came here, I was like, having some kind of pains, but, very few, the contractions. Midwife said that, I have to go through the cesarean section because, my baby is with, with the head, the bottom first position. So initially I knew that this is bottom first position. So, and now she's saying that my baby is having, the foot down in the vagina. So I'm concerned that, what will happen. And she said that I have to go for cesarean again.
May I ask a few questions about you as I am seeing you for the first time?
Yes.
Is it you conceived naturally?
Yes, doctor, I did.
Okay. It is your second pregnancy. I can got that from your case note. Is it so?
Yes, doctor. Exactly.
Okay. And now are you on 39 weeks? Exactly.
Yes.
Is it so? Okay.
Yes.
Can you feel your baby movements?
Yes, doctor. I am having, the pain. Yeah, but it's not that much.
Okay. And any problem? How after pregnancy was it goes smoothly or any kind of problem you have faced?
Everything was quite fine. I didn't had any kind of problem. Everything was okay. And it's just like, I have to go for cesarean section. That's it.
Okay. Have you done your bloods and scans in proper time?
Yes, everything was okay.
Okay. Have you been counseled about this, counsel about the mode of deliveries at your ANC visits by your midwives or consultants?
No, doctor.
Are you attending a regular? Have you done your regular ANC?
Yes.
Proper time?
Yes, I
Uh,
had my all checks done. Everything was quite okay, and till the morning, everything was okay. But now she's saying that I have to go for cesarean section again.
Okay, I am very sorry that you are not informed at the NC visits about the mode of deliveries, what the possible complications and what can happen. I am very sorry. And this previous pregnancy, how about your second gravida? What about your previous pregnancies? May I know?
Yes, doctor. In the previous pregnancy, I had an emergency. I was bleeding a lot, and I had, the cord prolapse
Mhm.
too. So that's why,
Mhm.
I had emergency cesarean section. And this time, I'm having emergency again. But I'm just worried, what will happen to me and my
Okay,
baby.
I can understand your concern, and that is natural. And have you seen your GP for any sort of medical condition you have? Any sort of diabetes or high blood pressure or some sort of things? Have you
No,
ever
doctor.
experienced?
No, doctor. I'm otherwise, fit and well.
Any family family disease you want to share of any significance? You want to say me?
No, doctor. Nothing.
Okay. Um, are you updated with your smears?
Yes, I am.
Okay. And regarding your personal history, I just want to ask you that do you smoke or alcohol or take any recreational drugs?
No, doctor.
Okay. Um, may I know your weight and height ratio?
Yes, it is 26.
What do you do for living?
Doctor, I used to work as a secretary.
Okay. Are you well supported at your home?
Yes, doctor, I am.
And how are things going last couple of months? Are you feeling low or depressed or in fit and fine?
No, everything is okay, doctor.
Okay, thanks for your information. Do you want to share anything information relevant to you? And may I know your blood group?
Yes, it's O negative.
And have you received any blood transfusion in your previous pregnancies?
No, doctor.
Okay. Anything you want to say that of significance? You want to add?
Not exactly, doctor.
Okay, thanks for your information.
Okay.
How is it, madam?
You tell me, how's it?
A little messed up.
Okay. So these kind of, the patients when they are laboring, so in laboring women who is going to go for second cesarean section, what are the important points you have to ask in your history? Hmm?
She's having pain or not?
No, no. See, we know that, she will definitely go for cesarean section because she is having foot-link breach. The major concern in here is when a previous scar woman is going for, the labor, the second cesarean. What exactly we are, the concerned of? Previous scar,
Bleeding,
previous,
rupture, that
previous scar,
rupture.
yes. Previous scar, okay. How was the recovery? Okay. How was she afterwards? In the previous scar, has she had any other complication post-operatively, wound infection or something? Because now she is going for this. In terms of, the scan, you very well asked about the scan. Don't say ANC, because patient is not going to be aware of ANC. Okay. Because
Okay.
this we doctor use as ANC. So we can just ask simply that, have you had your all blood checks, blood and, the scans done? Okay. Have you had your all frequent visits on time and everything? Okay. So this way you can just ask. In terms of this, the cesarean section, she is foot-link breach and now she is going for cesarean section again. So we have to be very careful about, the previous, the cesarean section, because we know as a doctor that, what are the complications associated with previous scar. The complications associated with previous scar, we should be knowing about her scan. Okay. So you can just ask about this. So can I ask that, are you aware that when was your last scan? So yes, doctor, it was at 36 weeks. Okay. So was everything okay? And are you aware of, the afterbirth location or the placental location? Because this is how you will be aware of that, whether she is having placenta previa accreta or something, because you have to exclude there and then. Okay. Even though she is having breach, foot-link breach. So yes, moreover, we should be very much aware of, things too. But on the other hand, from the previous, the scar, you will ask about, the recovery, wound infection, PPH, because APH can lead to PPH as well. Her baby, how was baby, and what was the gestational age at that time? Okay, that is very much important. In this, the pregnancy, you will talk about, how was the pregnancy so far? Was everything okay? You have had your all scans, all checks done. Plus, you will be careful about, the scan and the position of the placenta. Plus, you will be aware of, because moreover, if it was 10 minutes gestation, so probably she will ask about that, why not, the normal delivery? Why not vaginal delivery? Because I have heard that babies who are with bottom first position, they do deliver vaginally. So you can talk about that, okay? But later on, because we have to, moreover, you have to sign and consent form, you have to, take the consent as well. In that case, you will talk about, there's so many other things, because we are dealing with history at the moment. So yes, you will talk about, the allergy, you will talk about transfusion, you will talk about, the any concern regarding transfusion as well, because previous one, she can bleed, there can be any other problem. So yes, you will talk about, the transfusion, any concerns regarding transfusion, history of allergy, history of what else, in this current pregnancy, apart from this cesarean section, any other operation on the tummy or down below or anywhere, okay, in the body. So yes, family history of concern of clots, because this is going to be second cesarean. So yes, moreover, we have to be very careful about clots as well. So yes, we will talk about personal history of clots, family history of clots. That is very much important. Okay. So personally, what I believe is that in such situation, when woman is laboring, so you don't have to dig, more, because probably if this is the 10 minutes station, so probably you will deal with a very anxious patient. You will deal with a woman who is panting, the woman who is having labor pains. So she might give you, some kind of idea that, okay, she needs to deliver as early as possible. So at that moment, she's not going to tell you about my period. She's not going to tell you that, how's everything and blah, blah, blah. But yes, in terms of history, yes, you very well asked about support, but you are not going to ask about support in terms of, how's everything is at home. You will ask about, because this is second, the cesarean, she might need support in terms of, her recovery as well, post-op recovery. She might need, some kind of extra support in terms of, the extra support to her baby, to herself as well, blah, blah, blah. Okay. So you will ask about this. What else? So that's it. This is how you are
Regarding the
going to
first
ask.
pregnancy, shall I ask specific question about this cesarean scar recovery, or just I will ask that tell me about your first pregnancy? How was that like that?
No, you will ask about, so I understand that you had previous cesarean section as well. So can you tell me a bit more about it? This is one open question. Okay. Second open question. Second question is closed question. If you really want to ask targeted question, so you will ask that. I mean, can you tell me that? I mean, at what weeks you got? You had this cesarean section. So she will tell you 36 weeks. So you will say, okay, 36 weeks. And how was your recovery afterwards? Everything was okay afterwards. And did you had any kind of transfusion? Did you had any kind of wound infection or anything afterwards? And how was your baby? Was baby with you right after delivery or in the NICU? So at the same time, you will ask about, because this is preterm, right? Premature baby. So yes, you have to inquire about that. But my idea is that it's a very good idea that you start your consultation with, the kind of open question. Okay, can you tell me a bit more about your, the previous, the thing, or can you tell me more about your condition? That's it. So this way you will gather more information rather than if you will throw your questions to her. Okay. For the woman who is laboring, always limit your history, because the history will be very targeted. Moreover, in the laboring woman, you will have, the many, the stations in which you have to negotiate. If it is the breech position, rather, I mean, apart from footling breech, she is breech. She wants, the V back. She wants, the vaginal delivery. So probably you have to negotiate, so many things. Okay. So yes, you have to be very careful in history in the laboring woman, that you don't have to fulfill your complete template. You will be very specific. If you see the question is take brief relevant history. Take brief and relevant history regarding to previous scar, regarding to this pregnancy. That's it. Okay.
Sure, madam. Got it.
Okay. All right. Good. Otherwise, what I think is that you can speak well. All you have to do is that you have to rehearse bit more. Okay. You have to rehearse. You have to practice more stations like this, and more station like, the other modules as well. So inshallah, it will be very good for you. Okay.
Thank you, madam. Thank you. Thanks a lot.
Okay. Okay. Very good. Very good. Okay. So Aina, are you there?
Yes, ma'am, I'm here.
Okay, fine. No. let me give you the task, okay? Because this is again
Mhm.
the HMB somehow. Let me show you another task. Just give me 1 minute, okay? Till then, if somebody has any question, can ask,
No problem.
please. Let me show you the. Can you see the screen?
Yes, I can see.
Mm,
Patients related task, communication with
okay.
patients.
No. Let me show you the task. Okay, this is not the task. Let me show you. Just 1 minute, please. I'm sorry.
No problem.
Mhm. Okay, fine. Okay, so here you go, and your time starts now. Take your 2 minutes time and take. If you are ready, just tell
Okay.
me.
Okay. Can I start?
Yes, sure. Why not? Okay. Yes,
Okay.
please.
Hello, I am Dr. Aina, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yes, I'm Zoe Harley and I'm 25 years.
How would you like to be addressed?
Zoe is fine.
Hello, Zoe. How are you today?
Yes, I'm doing fine, doctor. Thank you.
Zoe, as I understand from your notes that you are 8 weeks in your first pregnancy and you have a health condition called epilepsy. And
Yes.
you are here to know more about your pregnancy and the condition you have. Am I right?
Yes, doctor. Actually, I'm epileptic, and I'm very much concerned that how this epilepsy is going to behave in my pregnancy.
Mm, I can understand how concerned you are, and I appreciate that you want to be a good mother and have a healthy baby. That's why you came to us for this
Yes,
booking. I
yes,
really
yes,
appreciate
doctor.
it.
Yes.
Can you tell me more about your pregnancy, please?
So far everything was fine and everything is okay. But I'm really much concerned that how exactly my pregnancy is going to be.
Is this a planned pregnancy,
Yes, doctor, it is.
a spontaneous one?
Yes.
How about the course of pregnancy so far? Are you feeling healthy, able to eat and drink?
It's just like I'm just like kind of nauseous, and sometimes I feel like throwing up, but otherwise I'm okay.
Any tummy pain,
No.
any bleeding, any discharges?
No, not as such.
Your water work, bowel movements, everything is fine.
Yes, I think it's pretty fine.
You did your blood tests with your midwife, everything?
No, doctor. Today is my first, the appointment.
Not yet. Yeah. Regarding your epilepsy, can you tell me more about this health condition?
Yes, doctor, I'm having this epilepsy for the last, I think I got diagnosed when I was 13 years. Until then, until today, I'm living with it, and I'm on, the couple of medications as well. So that's it.
Are you regularly following your doctor for this?
Yes, I.
When was your last visit with the doctor?
It was 3 months ago.
Did he know that you are pregnant? Did you took his advice?
No, he said that, because I didn't had fit for last, 1.5 year. So he said that, yes, he said it's better that you take, the contraception. Although we were practicing contraception, but somehow I got pregnant. But, I'm happy to continue.
Do you take folic acid?
Yes, doctor.
What dosage?
I think it is, a full dose, 5 milligram, 1 tablet a day.
What other medications you are taking? Or,
Nothing. Apart from this, nothing.
you have any other health condition for which you are following your GP?
No, doctor.
Your periods have been regular always.
Yes.
Any operations did you had ever? Tummy or lower down?
No, doctor.
Are you aware of your height and weight ratio?
Yes, it is 26.
Are you allergic to any medication or any foods?
Not as such.
May I know your blood group? Are you aware of your blood group?
Yes, it's O negative.
Can I ask you some personal questions?
Yes, doctor. Why not?
Do you smoke?
Sometimes.
Alcohol?
Yes, doctor. On weekends mostly.
Any recreational drugs?
No, doctor. Nothing.
What do you do for your living?
I used to work as a the primary school teacher, but because of my the fits and this, so I stopped working for last 2 years. So I'm just the home. I do online work and I'm happy.
Whom do you live with?
Yeah, my partner.
Is he supportive?
Yes, he is very supportive.
He is fit and healthy otherwise.
Yes.
In last few weeks, do you feel down, depressed, have lack of interest in doing things?
Yes, doctor. Sometimes I feel that I am lacking interest in doing things.
I'm so sorry to know about this, but we have good counselors. We can put you in touch with them. They will help you in this.
Okay.
Is there
Okay.
anything else? Is there anything significant in the family that I should know?
Not as such.
Anything else you want to share with me?
No, I think it's just okay.
As I from all this information, what I gather is that you are 8 weeks in your first pregnancy, and you have epilepsy, and since 1.5 years you didn't had any fits, and this epilepsy seems well controlled, and you are not taking currently any medication for this epilepsy. Am I right?
I am taking medications, doctor.
What medication?
I am taking 2 medications. One is carbamazepine and the other is lamotrigine.
Carbamazepine and
Lamotrigine.
So regarding this carbamazepine, as I want to make you sure that we have to take advice from your doctor that we can take another baby-friendly drug. As it's well known that this carbamazepine may affect the development of the baby.
Okay.
So
Okay.
I need to refer you back to your doctor and take his advice for this carbamazepine.
Okay. Fine, doctor.
Yeah?
That's okay. Yes.
Anything else you want to share with me?
No, doctor, nothing. Thank you.
Thanks for sharing all the information with me.
Okay, thank you so much. So, Aina, how was
Yes.
it?
Shaky. I think I in between I went here and there.
Yes, although you knew everything, although you know how to speak, okay, although you are pretty, the kind of, I think I must say that you are doing practice, okay, so that shows that you are very much, the fluent in the taking history. But altogether, this is a very easy station. This is very recurring station, epilepsy, and it can come as preconception counseling. It can come as, the antenatal care as well, and the birth plan as well. It can come as epileptic woman and she is asking for home birth. So obviously, it can come with multiple agendas. But all you have to do is that at least you have to be very fluent in your history, okay? Because epilepsy is a common condition, diabetes, hypertension, and even cystic fibrosis, even asthma, thyroid. So these diseases should be on your tips, okay? You should be very well versed that what exactly 1, 2, 3, 4, 5 questions I will ask about epilepsy. So for epilepsy, we know what type of epilepsy are you having. So she is having generalized epilepsy, okay? Since when it is diagnosed? At the age of 13 years, that's good. So what medications are you on? When was your last fit? Is it your planned pregnancy or were you on any contraception? So be quick in taking history, okay? Be quick in taking history, because these 4 5 questions you will ask, and then in terms of, the past history, you will ask about any history of, specifically any history of status epilepticus. In terms of, not in so many words you will ask about status epilepticus, but you will ask about, because of this epilepsy, have you ever had any kind of hospitalization in terms of, in the ICU, okay, or in the hospital for the longer period of time? Okay, so you will ask this because this is very much important. In terms of surgery, you will ask, your typical question, and is any surgery in the lower tummy or down below. In terms of, the medications, you will definitely ask about medication, because that is going to help in the management later on. Because in the management, then you will talk about for the drugs, because you have to talk about drugs. In terms of epilepsy, 4 5 questions should be on your tips at all times. Okay, and she is 8 weeks. If she is 8 weeks, then why are you worried about her LMP? Why are you worried about her contraception now? Okay, yes, it is kind of unplanned pregnancy, but she is happy to continue. And she had last fit 1.5 years ago. Okay, so still this puts her at high risk group, because from the guideline and the POG article, we know that if a woman has had fit more than 2 years ago, then she is going to be considered as low risk. But again, it is going to help you in the management. But yet, yes, you have to keep this in your mind as well. Okay, so midwife reports that she is nauseous. So for the nauseous, for the vomiting, for the nauseous, you have to be very careful, because for the anti-epileptic medications, you have to be very careful for the prescription as well. Okay, because then you have to say that if she is having vomiting after, the medications, anti-epileptic medications, she might need to retake the medications. So obviously that is going to be again in the management. But in terms of history, you have to be very quick. You have to ask, when was your last visit? Okay, are you, regular with your checks? Yes. And apart from this, any other medical illness? No. Any surgical history? No. Family history? Social history? Yes. You have beautifully asked about, the smoking and the alcohol and recreational drugs. That was very good. Support at home is very good. And she is, the down depressed, because one neurological condition can have, the other neurological condition, and that can be, the long-term process. Because anybody who is a long-term, the sufferer, so obviously, it will affect mental health too. So yes, you beautifully dealt that part as well, that I'm sorry you are going through, we have help available, so I will put you in touch with counselor. That was very good. So I think altogether it was good, but just be quick in, the taking epilepsy history, plus do address this nausea as well. Okay, because for the nausea you have to give, the medications. For the nausea you have to ask bit more, and I think that's it. Okay, Aina?
Thank you, ma'am. Thanks for the feedback.
Okay. So all you have to do is you have to rehearse more, okay? And don't be like, up and down. Don't be like, kind of, because you know that how to take history and how to talk, okay? That is very good, in fact. Just, are you for a February exam?
I am planning, yeah.
You are planning? Okay. So I think you are ready. You just need, more practice. You just need, the kind of bit more rehearsal, and then inshallah you're good to go.
Thanks, ma'am. Thanks.
Okay. So I think Any feedback? Any other question? Any other question regarding history? Because I think we have discussed 6 cases today, and I think this is kind of good. Any question? Anything? No question? Okay, okay. That's very good. So probably in near future, I will arrange another session on some other exciting stations too. If somebody has any query, if somebody has any kind of question, you guys can reach out to me. If you guys want, the personal help, if you guys want to take course, you're always more than welcome to contact us. Okay, and our team as well. So please, don't waste time, because February is just around the corner. All you have to do is that you have to rehearse, you have to talk. Unless you don't talk, trust me, it is not going to help you at all in your preparation. Okay, you have to speak, you have to rehearse more. Regarding the exam booking, yes, that is a very challenging job these days. All you have to do is that, for the booking, I must say that, you should have a very, the fast internet. Once you are booking, so be very quick in booking too, and be online, I mean 5 to 10 minutes before, and be there and turn off your all unused devices when you are the planning to book exam, and make your 1 or 2 cards with you, and preferably it should be credit card, okay, not the debit card, because sometimes the debit card don't work. So do use the credit cards, okay, and make sure that credit card has enough limit as well. So that should be that should be there too. And apart from that, I think, if you get a chance, this is another advice to all of you, that this is going to be a chance. If you get a chance to appear in February, go for it. Okay, don't waste the chance, don't lose the chance in the fear of that you cannot prepare. Trust me, anybody who has done part 2 and who has little bit knowledge of English, this is all about how you communicate, how you behave. This is not a knowledge test, this is not your the English language test. Okay, don't be shy in talking, don't be like, hesitant in speaking and rehearsing. This is not English language exam. Okay, so everybody should be in good spirit. If you guys get a chance to go for February exam, please do go for it. Okay, because these days everything is kind of difficult. If you are getting a chance, do avail it. Okay, for help, for anything, I'm always there. You know my name, Zaib Qureshi. Reach out to me on Facebook, on Telegram. Okay. So if you guys need any kind of help, our team is there 24/7. So these are the numbers. We are currently, heading a course. Okay. And we do have, the very, the excellent mentors with us. So we do run, and even one-to-one, the courses are also available. So if somebody needs, the my help in terms of one-to-one, so yes, our team will announce those, the things as well in a day or two. So be there, and if you guys need any kind of help, do try to get in touch with me. Okay, all the best. So please, please, please rehearse more. Rehearsal is a key, practice is a key, okay, for this exam. All right, so thank you so much for being with me today. Thank you so much for the participating and practicing. I hope I have been the little helpful in your preparation. All right, see you inshallah some other time in some other session. Take good care of yourself. Bye bye.